Thank you so much. You all may be seated. You all may be seated. Please put your hands together for yourselves. We are so excited to talk about this Mrs. Mom, new day 4, newborn handling, dental derma care, and stress management. And we have wonderful.
Take a minute to distribute something. There's a little sample that I'm giving everybody to try. So today we're talking about aromatherapy and its benefits. I am Mansi Vuppala and I have a brand called Live Pure Co. And we have just started this luxury brand of aromatherapy products. We've got candles, bath salts, essential oils, and some more things which are coming up very soon. We're also doing a collaboration with Dr. Reddy on some medical essential oils and soaps, which will be available soon on the website and also at the hospital. And these are all handmade products. Let me know once all of you have received the sample, and then we can start. Done, Shilpi? Okay. So guys, open the sample that you've gotten. It's a calming essential oil blend. It's called Pure Heal. I want you to dab a few drops on your palm and rub it and smell it. Please give some to your partners also. Wellness of body, mind and spirit. The emphasis of this technique is to focus on prevention rather than cure. So if you want to work on yourself, this is your best partner because it helps you to relieve stress, fear, to relax, to meditate, to release anxiety, find joy, to let go, to balancing the chakras and so on. The list is endless and the journey is beautiful. Now, what are essential oils? Essential oils are basically fragrance which are produced in the secretory cells using nutrients from the soil, water, light and warmth of the sun. These cells are near the surface located in the flowers and leaves. The essence are defined as a life force, energy, soul and spirit of the plant. While these essences are distilled, they undergo certain chemical changes and become essential oils. These potent plant compounds, much like Ayurveda, have different benefits and properties They are used extensively for mental, physical and spiritual benefits across the world. Now, how do we use these essential oils? I'm also going to be dropping a little PDF with some blends and some recipes for you guys to explore in the future. And we will also have them for you to buy from us. So you can use essential oils in a diffuser and you can use it topically, and you can also do steam inhalation. Now, when you use essential oils in the right way, you can address a number of day-to-day issues like stress, cold, congestion, anxiety, depression, and even just for clearing indoor air pollutants. Now, how do you use these essential oils topically? So when essential oils are applied correctly, they can be used to address everyday worries such as skin care, hair care, acne, dandruff, pain relief, inflammation, even for massages and repelling insects. When used essential oils, they need to be diluted in carrier oils such as coconut, jojoba, apricot, almond, walnut, and so on, depending on your skin type. So when you use an essential oil, please never use it on your body directly. You need to dilute it in a base or a carrier oil, and the dilution should not be more than 5% for adults. Now, how does your smell work? So what happens when you smell these oils? The odor molecules present in the essential oils directly send a signal to your brain receptors, and it happens instantly. More specifically, the limbic system of the emotional brain, which is responsible for memories, breathing, blood pressure, instinctive behavior and emotional reaction, gets activated. So you must have also noticed that there is a large memory attached to your smell, and this memory is formed in your brain according to the smell that you have around you at that moment. Now, how to use essential oils for diffusion, we all know. You can just use it to uplift your mood or for whatever cause that you're addressing. I will give you a few blends that you can use in your diffusers. Now, what is the difference between an essential oil and a carrier oil? Essential oils are strong plant extracts and cannot be applied directly on your skin, whereas carrier oils are used more for taking these essential oils to your skin. They are made out of seeds, nuts and kernels. So now these carrier oils basically are fatty acids, and they have omega-3 and omega-6, and they also are used largely in skincare, and they have the ability to nourish your skin. And when an essential oil is diluted in a carrier oil, it prepares your skin for absorption. So now when choosing a base oil for your skin, especially for your face, please be careful, because they will react to skin which is sensitive or dry, or combination can be prone to acne. So you have to make sure that you're choosing a carrier oil depending on your skin type. Now, the most commonly addressed concerns with essential oils is cold, cough, congestion and headache that we face in our day-to-day issues. So what we can do is that we can use these essential oils for steam inhalation, because that is the best technique for cold, cough and congestion. And so what you do is you make a blend of eucalyptus, peppermint, and you can put it in a tissue and carry it around with you in your handkerchief, or you can even put it in your hot shower. Put a few drops and that will help with your cold and congestion. While taking steam, you have to make sure that you put either eucalyptus or peppermint, not both, and you can do this for 5 minutes in the morning and ideally when you go to sleep. Do this for 2 days, you will find a lot of relief. You can also apply lavender and peppermint oil diluted in a carrier oil on your temples whenever you have a headache. Now for cough congestion, you can also use thyme oil as a steam inhaler. It helps instantly for congestion or cough that you have. Okay, then you can also make a chest rub And I will drop some recipes with chest rub where using basil, ginger, peppermint, and eucalyptus. Now you can use these chest rubs, you can make these things and keep it in a bottle, and either you can apply it on your chest directly, but do patch test it before you apply it, or you can even put it in a roll-on bottle and carry it around with you. And for skin allergies, jojoba, tea tree, lavender, marjoram works best. For migraines and headache, peppermint, eucalyptus, jojoba and lavender works best. For pain relief, for muscle, you can use jojoba, peppermint and ginger. For inflammation, jojoba, nutmeg and frankincense. So for diffusion at home, for uplifting moods, you can use some lemongrass or spearmint, and you can just get an inhaler and even try it in your inhaler. You can get an empty inhaler in a medical shop. You can put a few drops in the cotton that is available in the inhaler, and then you can make your own inhaler also. It's completely safe if you're buying pure essential organic oils. And again, I want to say that when you are using an essential oil on your skin, please make sure that you dilute it and do not apply it directly on your skin. And when you're using a base or a carrier oil for yourself, I would suggest for Indian skin, you use locally sourced base oils like sesame, apricot, walnut, coconut are like great options for Indian skin types. I hope you guys got some insights of aromatherapy from this session. Please follow us on Live Pure Co. and give us a feedback on the oil that has been given to you, and it will be available for you to buy from tomorrow. We also have a stall outside with some candles that we have made in collaboration with Dr. Reddy. It will help you with your anxiety, with your stress, with just wanting to calm down, take a moment for yourself. Please invest in your own mental health. It is very important. It is more important than your physical health. So please make some time for yourself, even if it's 5 minutes every day. Make this a routine of sitting with something which creates an aromatic memory in your life. You will start seeing a lot of differences in your life. Thank you.
Thank you so much, ma'am. Thank you so much for all that wisdom which you are sharing with us, which are absolutely great learning for all of us. And I'm learning a lot every time I come to your session. So I keep hearing a lot of good things. And somebody has a question too, madam. Somebody has a question for you. Are we doing the questions now? How's that? Yes. Yeah, we can do that. Yeah.
So you mean to say your sense of smell is strong when you're sleeping also?
No, brother.
So usually the sense of smell is something that works whether you're sleeping or whether you're awake. So if you have a strong sense of smell, then you use and dilute your oil according to what your preference is. Don't overdo the oil, because sometimes when you are going on smelling a certain aroma which is not feeling nice for your body, you might tend to develop like a headache or like nausea. So that's why when I'm giving you recipes, which I will be dropping in a PDF, it has options. So whatever issue that you want to address, check what option works best for you.
According to baby, okay, and whenever baby is sleeping, you need to sleep, and you instantly don't get sleep. So, is there any like aroma techniques which will help in that?
So the one reason that also creates like the problem with your sleep is that I think pre-pregnancy, like during your being pregnant, you have like a nausea. So ginger and lemon work really well for nausea. Once you address the nausea, you will automatically start feeling a lot better. Now again, mixes like lavender, patchouli, ylang ylang, the one like that I've just given you guys, that instantly helps you to calm down. So what you need to do is, like, before you go to sleep, take a moment,
rub some oil or put it in a diffuser. The best way to do is to rub it on your pulse points because it instantly goes into your skin, gives a message to the brain. This oil that I have given you guys is a blend with grapeseed and almond oil as your base oils. And I have added a blend of lavender, patchouli and ylang ylang and some more ingredients in it. So what you can do is you start using the oil before you go to sleep, a few minutes before you go to sleep. Sit with yourself and just feel the aroma around you. It will start giving your brain a signal that it's time to go to sleep. So you start creating that as a routine. So once you get used to it, even with your child, it's absolutely safe if you're using pure essential oils to have it in a diffuser in the room. Obviously, please keep it at a distance from your child and all that. So you will create that atmosphere in the room where the child and you will start sleeping more comfortably. Thank you. Anybody else? Sure.
Just the last question.
Sure.
Is there any mixes which we should avoid? So when you say we should mix essential oil with cadder oil, so cadder oil could be coconut oil or almond oil or any. So are there any mixes which one should avoid?
No, so it's basically how your body is reacting to something. Like I said, you can try a few blends or you can try alternative oils that I will be giving you. Something that you are not feeling comfortable with definitely needs to be avoided because again it's a very personal choice. Everybody has a different way of receiving these oils. Thank you. Sure.
Oh, we have two people now at a time. Alright, let's start. Let's go from this side.
You can be seated and ask me your question, that's fine.
Thank you, ma'am, for the session. So I think many of us are facing this issue of itching. So is there any specific oil or aromatherapy, any topical agent which is plant-based which we can use in our we are facing a lot of itching during this time.
So again, itching has to do with skin nourishment. So you need to make sure that you have a nice thick base oil which is helping you. Maybe almond or walnut can help. And apart from that, you can mix a few drops of peppermint because peppermint takes care of your itching. It also gives that minty effect, so it starts feeling good on your skin. But like I said, not more than 5% of your essential oil goes into your carrier oil. Okay. So you can make a mix. Take 100 ml of a carrier oil, put 5 ml of an essential oil, of peppermint oil, most widely used for itching, and keep it with you. And you can start applying it every day while you go to sleep or after your bath. You will definitely see a change. Even coconut oil works fine.
Hi, Mansi.
Hi.
So, I'm just planning to make a DIY hair conditioner.
Okay.
But, I just want to add some nice smell. So, can I just go ahead and add rose essential oil to that?
Definitely. Rose, saffron, sandalwood. All the essential oils which are pure and plant extracts are completely safe for your hair and skin. It's just that, like I said, depending on your skin type and if you're prone to acne or you have sensitive skin, you need to make sure that your base oil is right. And that you will only understand going to your dermatologist or trying a patch. Hi. So for chest congestion and for cough issues, thyme works really well. So you could try thyme oil. And since you have, whenever you guys have an issue or something that you want to address with essential oils, you can just message in the group, I'll reply. As much as I can. Not some major issue, but day-to-day small things can definitely be not cured, but you can address the issue and calm it down to some extent. It's more like a preventative method and not a cure. So for a cure, you definitely need to see a doctor.
The essential oils you said it is safe for the babies, right? So from which age onward, months onwards, we can start, putting the diffusers or something like that?
So diffusers can be put right from the beginning. There is no harm. Do not apply topically for the babies yet. At least till 1 year, I think Dr. Shilpi would be the right person to tell us when they can start applying it for the baby. But carrier oils, obviously like jojoba and even almond is very safe for the baby to apply.
Okay.
Yeah.
Thank you, ma'am.
Thank you. Anybody else? Okay, there's one person there.
Hi, ma'am. I wanted to ask which is the best oil that can work during meditation? Because during pregnancy, to burst stress, we usually do meditation. So, is there any specific oil that can work best?
The blend that I've just given you guys. So
Lavender.
lavender, patchouli. These oils instantly calm you down, create like a de-stress environment around you and help you to focus, meditate. And also lighting a candle during meditation also helps because it helps you maintain your focus, keeps you in the present moment. So you could try lighting a candle every day for 10 minutes, not more, and meditate with it.
Thank you.
Thank you, everybody. Do check out our stall outside and please give us a feedback on Live Pure Co on Instagram. Thank you.
Thank you, madam. Thank you so much. Please put your hands together, ladies and gentlemen. Will you give a Hyderabadi style of hand clap? Thank you so much. And we want to honor your time. We want to honor all that effort we are putting across for all of our friends and family here. I think it's time. So we request Shilpi ma'am to please do the honors. And ladies and gentlemen, come on. Moms to be, dads to be. Good qualities of clapping so that your children will also learn and they will keep doing that. Thank you, madam. Thank you so much. Thank you so much. Thank you so much. All right, moms to be, dads to be. All right, so we have many dignitaries coming today. We have wonderful people joining us today, and in that, I would take the privilege of calling upon Dr. Charan Koganti garu on the stage. Can you all put your hands together, ladies and gentlemen? And with an honorarium, we have Dr. K. Shilpi Reddy madam here on the stage. Charan Koganti garu is a renowned neurophysician from Hyderabad. He has been working as a consultant with KIMS, and his areas of expertise includes mental health, includes such as stress, depression, anxiety, disorders, sleep disturbance, addiction, he is an amazing person. Ladies and gentlemen, I think it's a great time to hear it from sir. Thank you, sir. Thank you so much for your time. Over to you this morning.
Hello everybody. Am I audible? Yes. Good morning to one and all. I'm surprised to see a packed room at 10:30 on Saturday. I think most of you are IT employees, so I don't know how Saturdays work for you. For doctors, it's just another day. So I'm really surprised, but thanks all of you making it here for today's session, which is rather quite important, called stress management. First 10 minutes I'm going to scare you about stress, and then I'm going to try to diffuse you about stress for the rest of the time. Yeah, I'm going to make it interactive today because I would like to, there's nothing great that I'm going to teach you today, right? If you Google how to reduce stress, you can do yoga, meditation, it comes on Google, right? You can know that. But I want to know your stories of how do you manage stress and what stresses you, especially in pregnancy. And the tips I'm going to tell you today are pretty simple that you can incorporate in your daily life and you can carry it much after your pregnancy. This is not just for pregnant women. This is for everybody in general. But yes, what stresses you could be different now than when you're not a pregnant woman. That's the only thing. But how you're going to respond to it, how you're going to let your body react to it is completely in your control, right? Firstly, what is your understanding of stress? My understanding of stress is that if I'm faced with any situation that I'm not prepared for, or I think I'm not prepared for, my body and brain will react in a certain way that stresses me. For example, pandemic, right? None of us saw it coming. It was completely, I never thought I'll live through a pandemic. Right? My grandmother, who is a gynecologist, who is 83, was telling me about some pandemic. Probably briefly, she was there when we got our independence. Right? I thought, oh, it's never going to happen with such advanced healthcare and great sanitation measures that we doctors and everybody practices. I thought, oh, there'll never be a pandemic. But here we are. But I'm sure that first wave was a lot more difficult for you than the subsequent waves, right? What does it tell you? Even though the impact is quite high, in the later waves, right, why was first wave very stressful? Example, when there were 4 cases in Hyderabad, why were you so stressed than when you had like 3,000 cases in Hyderabad? You're right? Correct. You're not used to it. You're not aware. You're unprepared, basically. Correct? You're unprepared. I remember everybody cooped up in their rooms with 4 cases in Hyderabad. With 3,000, everybody is out in the malls shopping. watching movies and doing everything that you can. So this only tells that stressor didn't change, but how you are reacting towards it definitely changed, right? How you process it, or how much of it you are prepared in your head. Some of us are prepared to lose our jobs and thinking about alternate jobs. Some of us are planning to, I shouldn't say this, but somewhere, some of us anticipated that, something might happen to older people in the house if they get pandemic, right? Especially as a doctor, when I'm going home every day, in the beginning, I thought, okay, I do go back to older people in the house, and even if I get contracted with COVID, that's maybe I will make it, but what about them? And this obviously was quite stressful, right? But subsequently, that feeling has, even though it stayed with me, but how I reacted towards it changed, correct? For example, I'm coming here, right? Completely unprepared for the talk, right? Because I do give talks, so I don't specifically prepare. So there is a certain amount of anxiety, and I opened the live video that is being telecast, and there were so many people, right? So addressing to 10 people is different than addressing to, like let's just say 100 people. It is anxious, right? So what do you think I did? One thing is I can start late, rush through the traffic, get irritated in the traffic, and feel stressed even more to not make it on time, and come here and totally be overwhelmed by seeing so many new faces. Versus, I plan my day well in advance, start little early, manage the traffic better. I even stopped at there's a lake somewhere here, right? I stopped at the lake, I pulled over my car, got out, took couple of breaths, didn't smoke, right? Took couple of deep breaths and came here. So that's a big difference. No, how do you cope with this situation? But I do know someone else would have smoked in that situation. Someone would have, like, maybe driving and smoking, or stopped somewhere and smoked and would have gotten. Even though smoking gives a temporary sense of relaxation, right? You'd feel like, oh, your muscles are relaxed and your weight is lifted off your chest and head and all that. But it triggers your anxiety hormone production even more when you are in a specific situation. So then you tend to again go and smoke. Probably I would come here and go to the washroom and smoke. This happens with a lot of patients that I see. So what I'm trying to tell is, stressor and coping is what you need to know. Don't think that, oh, talking to a psychiatrist or coming to this talk or talking to a therapist will remove stress out of your life. That's not going to happen. Stress is the only constant in our life, and how we react towards it should change. Okay? Now, I would like to know, what are few stresses that you all are facing? Yeah, you don't have to stand. I mean, even men can speak. Yeah. Yeah. Work stress, right? Yeah.
Check one. Yeah, I think if you can stand up so that we can give the mic to the person who's standing. We have 2 people, 3 people at once. So it's hard if we have 3 people together. I think we'll go one after the other.
Handling children is a stress.
You already have children? Like for the future, or you already have a child?
Already have a kid.
Okay. Second child, okay. Yeah. Yeah, handling toddlers is very stressful, you're right.
One thing is coming to Mrs. Mom at right time and and thinking that we'll be in the last 40 contestants or not. That is also one kind of stress. I think most of you all can relate that. And then, then how we take is like, it's okay, we'll come till 24th. At least 24th is the last day for all of us. So, thinking in that positive way is also a different way to handle that stress. Like till 24th, we can come here and enjoy and just move out. That is one kind. Thank you.
Okay, I would say rather than thinking positive, I think thinking more practical and preparing for the outcome, I think will be more enduring in a longer, in a long term. For example, like you said, I'm stressed that from 40 we come to 24. And what next? Instead, I would, if I were a contestant, clearly I can't, but if I were a contestant, I would be like, I'm not going to look at winning this. I'm going to learn this, use this as a learning experience, right? I don't have to win it. Like in my mind, I already thought that I don't want to win it, right? I want to go through the entire process of transformation and get opportunity to meet people, not just us, but meet fellow pregnant women. Because if you look at other countries, a lot of pregnant women, they form support groups. I think something that India lacks. We don't even have Alcoholic Anonymous much in India, unfortunately. Imagine pregnant women getting together. But I think there's a wonderful movie that I was watching yesterday, coincidentally, called Wonder Woman. This is on Sony Live, and I'm not promoting, I'm not getting paid for it. But I think it has Nitya Menon and all amazing actors, where it's a story of 6 pregnant women who come from completely different socioeconomic strata, coming through different life situations. One is married, one is single, with a live-in boyfriend and got pregnant. Another is in a very controlled environment. She brings her mother-in-law as well to the pregnancy classes. And she asks the tutor that, oh, can my mother-in-law join? The lady says that, yeah, she can if she is pregnant. Why not? So, I mean, from different walks of life, these women are coming, and how their stories evolve together, and how they find friendship amidst all the chaos, I think is wonderful. So I think this opportunity you should see as finding like-minded people, right, and becoming friends with them, and sharing your experience, not just in the pregnancy, after, right, because pregnancy is one part, and raising a child is another completely different part. I think Dr. Shilpi should do something about raising children part also, because there's next, yeah. So then also you can still be friends and share your experiences. I think there's something about shared grief, right? If you know that everyone else is also going through similar stressor, it's not sadistic, by the way. It's not sadistic in any way, but there is a comfort in that, correct? It's human, like, accept it. If everyone else is going through the shared trauma, I think it is a lot more easy on you than you feeling things so personal that this is only happening to me. While sometimes our brains trick us to believe that, oh, these are happening only to me, right? I tell my patients, things may not be as personal as they seem, right? It'll make sense to you, where you feel like, why am I going through this? Why do only I have to go through this? It's always the question of, oh, it's me that this is happening to me. Why is this happening to me? What have I done? Am I such a bad person to go through this? It's nothing like this circle of life, we go through ups and downs and accepting. So to what you said, I think if you're already lost in your head, you're going to actually emerge as a winner in a different way. That's a thrill in itself, right? So think about that. For example, when I was writing my MD exams, I didn't care that if I had to win or pass or fail. I thought, I'm going to give it my best. Let's just see what will happen. At the end of the day, when I am sitting as a doctor, nobody's going to come and ask my percentage, right? Nobody's going to come and say that, oh, so did you get a gold medal? Did you get, silver medal? Nobody's going to care. They're only going to care about how I represent myself and how I'm going to treat them. Am I going to be compassionate or not? Am I going to help them cure their problem? So will they come back to me? Only that matters, right? You probably won't even know where I studied from. You'll only know that, okay, I'm working with KIMS, so it's a good place. So probably they have checked his credentials and he is a qualified doctor. That's all. You'll trust in the agency, correct? So same way, I think how much you can control is what you should take into hands. Okay. Somebody said about the, I think you already have a child and second child could be stressful, right? Okay. So you're worried about the first child. You're still worried about the first child, right? Okay. One important tip here is the moment you have second child, the entire focus is shifted towards the second child, right? It's natural. Even as a parent, if you are not doing it, your in-laws might do it. Your own parents might do it. Your neighbors might do it. This is when the first child feels displaced from their position, right? It may not go well with most of the kids. Understand your just born doesn't know anything, right? Still doesn't know. At least for 2 years, they won't know what's happening. I think that's when, I think the most important time of care is for the first child, not for the second child. At that time, it's very important because there's something called as sibling rivalry, which is a real concept where I think most of you, even today, I think not most, some of you, hopefully not most, some of you might not be very fond of your sibling, and there is no specific reason why so, right? When you go back in therapy and realize that displacement starts right from when your younger sibling is born. Suddenly everything is shredded. You feel like you're displaced in your position. That won't go down well with a lot of kids. So that's why they say they shouldn't be full, right? How many watched that movie Upuri? Nagarjuna's, right? Karthik creates a masterpiece, right? Without even knowing. So you never know. Maybe you can become millionaire by just splashing colors, right? So same way, don't worry about the outcome, and I paint. Now, if I were to become pregnant, which I can't, but if I were to become pregnant, I would again go back to the same coping mechanism. So because you already know that, okay, these are tried and tested. Not because Dr. Charan said. It's because you actually lived through the stressor and you actually done it. So tell me some of the coping strategies that you guys follow in any period of stress. Forget about pregnancy. Yes. Yeah, please go ahead. Staying quiet in the moment. Okay.
Hi, sir. Hi, sir. When I feel stressed, I listen to some good music, either it be filmy songs.
That you're talking to may not be equipped to help you. I'm sure, like, your spouse is not a therapist or a psychiatrist, right? So maybe, yeah. So if you're talking to them, maybe they won't be able to handle that. Sometimes what happens is it becomes like a punching bag, right? You keep talking to one particular person. You go all guns blazing that, oh, this happened to me today. This is how I responded. My workspace, this happened. It didn't go down well. So over a period of time, the other person will stop listening because they're not trained in that area. There's nothing much to blame. It's just that I believe that they're not equipped in that area, right? I can sit and feel bad that, for example, like I saw this patient yesterday who told that for years of stress, I spoke to my friend, and now that friendship doesn't last anymore. Like, she avoids my calls. Understand that other person also might be going through something, and it might be difficult for someone to take your load as well here. So one effective way is talking to a counselor for sure. But if that is not happening, something like journaling, because you can't immediately get on call and talk to a counselor. You need to take an appointment.
So just recollecting the words and think in positive way. Then it gives a lot of relaxation to me. Again, back to the regular daily works.
Okay. So what she's saying is, whenever you're faced with a problem, you can do how to get a solution out of it. And also remember not to repeat the same mistake again. Like, go back to this, write it down somewhere that I have done this, so this costed me this. I'm not going to repeat it. Right? Making mistakes is all right, but then making the same mistake, I think, is kind of stupid. Like, don't go back to making the same mistake. Like, most of us are used to keep on making the same mistakes again and again and again. Right? That's one thing. Yeah, someone said about journaling. I didn't finish about journaling. Write it down. You don't have to write like a diary of like 1 hour, 2 hours. He said, she said. Just write down that what are the triggers, what is your behavior, is it healthy for you, unhealthy for you. Simple. What is your thought, how your body reacted, what can you do to alter the thought. For example, if my thought is that I might carry infection home to my mother, which might be detrimental to her health, which is very stressful to me. Now another thought can be that I may not carry the infection home to my mother. I would be careful outside, right? That gives me some relaxation. I'll be like, even if she gets infected, there are doctors enough to take care of her. That gives me some more relaxation. I'm done for the life.
Yes, I want to add. Actually, most of my stress earlier was work.
Childbirth and child rearing is both partners' work. Understand this. Rather than burdening each other. So I think you and your partner will have to like sit and talk and frame a plan about child rearing. It's very, very important because a lot of couples get very distant after the child is born, unfortunately. Lot of unspoken things and unsaid things and unspoken feelings, all this get in between their way. Understand, one person that you live with the rest of your life is not even your child but your partner, right? Your children will find their life and, go back, go wherever they want to go. At that time, lot of couples, I know a lot of, let's just say my aunts or uncles, they live separate lives completely. They live in different floors, they have different bedrooms, they live completely different. Probably that has started much early in their life because they have invested everything into the child. What you should know is, you both are there to solve a problem, not prove who is right, who is wrong. It's not court of law. And certainly you're not there for that kind of solution there, right? So you both have to work as a team here. It's always, you both are a team, remember. You both are not like my parents versus your parents, me versus you, my akka versus your anna. No. It's always, it's always you both are together. Now both of you together, without getting egos burnt and bruised, just come to solutions. That will definitely help. Yeah. It's as easy as it to say, but it might be difficult to practice, but slow steps, right? Yeah.
Sir, I have a question, not a solution here. I have a constant worry that, how do I give my baby to a daycare or anything when I have to go back to work? Like for my first baby, I was able to take a 1.5 year break and have spent time with him. But now I'm back to work, now I'm pregnant again. My office doesn't allow 1.5 year break for the second time. So So there is always a constant worry of what to do. Do I have to quit my job, or how do I balance that? Like any choice I make is not easy for me. So I wanted to understand how do I
This is something that you have to think, right? Which is not fair for the child. This is something that you have to think, right? Which is not fair for the child because it's your decision to have a child, right? You can't listen to the child later. Mothering is all about, mothers are, great with sacrifice and all that, and we love those mothers who sacrifice their entire life for this. I don't believe in that, right? When you look back and see what is there, you are not the only child is there. But I do believe that you have to take care of yourself, not just a pregnant woman, but after that also. If you feel like doing a job and manage child, if your husband is able to do it, both of you should be able to do it. By this session, men will be like, what has he done? Why has he changed the dynamic and left the room? No, but think about it. Like I said, you both are going to live together forever. So you both have to live happy, not your child comes later. Okay? Without being selfish. This is self-care. It's not selfishness.
After this COVID came down, it has been like, okay, stepwise going out. And especially I can say thanks to KIMS Cuddles, that the Sunday yoga which they had, that was especially helpful for me. That to step out, okay, it was even productive and not like just roaming around, leaving the kid at home. And they even allowed kids. That was even more with the Zumba classes and yoga. Yeah.
Now understand when you're stressed, right? So brain has an appetite center and thirst center. Both of them from the same area called hypothalamus, right? A lot of times you don't know if you're hungry or you're thirsty. Your brain might be giving a false alarm, right? So I think most of the time it is thirsty. I think Indians have a nasty habit of drinking water only when we eat something. So that is like three meals a day or 4 meals a day, 4 glasses a day, right? Your brain needs 3 to 4 liters of water minimum. Unless your kidney is not working and the doctor told not to take and you have edema, those are different situations. But for more rest of us, you have to have at least 4 liters of water per day. You can't run your car with no fuel, right? I mean, you can with electricity, but otherwise you can't with no fuel, right? So same way, your brain needs water, oxygen, glucose. If you deprive yourself of these 3, right, your brain is not going to work. Your brain will throw a tantrum called stress, anxiety, panic attack, and whatnot. So for the people who come and tell me I'm not able to focus, the simple thing is go drink 5 liters of water and come back if you still are not able to focus. Then we'll talk about it, right? So you can probably do stress drinking, drinking as in water. Stress drinking is what you can do. Yeah, you can drink a lot of water, so you're giving signal back to the brain that, oh, my stomach is full. When your stomach stretches, right, it gives signals to brain to stop the impulse. And also uninstall like Swiggy and Zomato from your phone. That'll help.
Hello, good morning, sir.
This is routine life, not only for me, for everyone as well, of course. But this would be a stress.
Okay. If it's in a professional life, don't carry your work home, right? So your boss may not like you. You may not like your boss for various reasons. You may not like a certain employee. You may not like your team lead, right? You may not like your ex-friend who is not your friend anymore, right? All this can happen. So don't bring that home. Like what's your purpose at work? Purpose at work is mostly to work and make income for your livelihood. That's the most important thing. If there are good social relationships coming out of it, fantastic. If not, it's okay. You can come back to your family, right? Having this clarity, it's okay. You can come back to your family, right? Having this clarity is important. See, not everybody in my hospital likes me. I'm hoping everybody does, but like, you never know, right? But that's not in my control. But am I doing actively for people to not like me? Then I'm going to change. I'm not going to be like, I'll be myself and apologetic myself. No, I'm not going to be unapologetically me. Like, I have to modify myself so that, not so much, but to a little extent, if I think that, let's just say that if I come across little too direct for people get hurt, then I'm going to change myself a little bit. But if I feel like I'm doing everything I can, but the other person not like me, again, that's the locus of control. That's not your problem, right? So I think having this clarity is important, and don't expect everybody to like you. You might be the most wonderful person in the room, but everybody won't like you. The fact that you're the most wonderful person in the room might be the reason why a lot of people don't like you as well, right? So have that clarity, that is important. But if it's in your personal life, right? Yeah, in your personal life, I think you will have to like definitely go see a therapist, right? And work with that person. For example, you and your husband, I'm not saying your husband, like you and your husband are having some relationship issues, right? And you're not liking the person that he's become, right? But whom you married were completely different, and with situations people change, right? Address it to that person, not in a fight, right? And don't use these two words. Like people say, you always do this. You never listen to me. Like always and never are a big no-no in here. Like that has to go out of your Oxford dictionary in relationships, right? It's not fair that you say that you never do this for me, right? Or you always do this. You're always using these words in negative connotation, right? So don't use that. Or write on a paper and give it to him that, I see that we are having some issues. Like I would like to fix this with you because you are an important person to me, right? Can we go see a therapist, right? Whatever. So that communication is important. Don't expect your feelings to be understood by the other person just because you're quiet or you're passive aggressive or you're passive for that matter. Communication is key here, and how you communicate is important. Most of us communicate in fight. We keep quiet. In a fight, we just explode and say that, you did this. You are the reason why I'm here. So communication is important. If the person is never important to you, I think don't worry. You're fine without that person in your life.
Yeah, hi doctor. Rupesh here.
Hi.
Yeah, I'm into IT industry. So every industry will have their own stress. I agree with that. So how do I come out of the stress is my son. Okay, I'll spend some time with him, play with him, and that will relieve my stress. But my wife's case is different. He's a stress creator. Feeding him is big stress for her. And after feeding, he'll tell, I love you, mama. I love you, ma. And that will relieve her stress.
Okay, now I'm going to burst your bubble. If your wife is getting stressed for your child and not you, then your wife is doing most of the work for the child. You're being the happy father who comes home after work and plays with the child. Both of you put an equal effort.
And now one more stress he's creating me that he wants mic. So I'm just releasing that. Say hi. Say hi.
Hi.
Thank you. Thank you, ma'am.
Hello. Hi, sir. So, there are a lot of macroeconomic headwinds going on, and, there are layoffs going on into the, global workforce. So having said that, most of us, those who are in corporate world are already dealing with a lot of stress, and then we have a pregnancy, and then we want to take care of everything, right? Whatever is in our control. But then it is making us difficult to, to concentrate on both sides of the world. It's very stressful. I don't know how to deal with that. I try to deal with as much as I can, but then it is very difficult to understand. Maybe you can, help me or help all of us, right, who is going through this thing, right?
Okay, so I think it comes down to two things, right? One is job security, another is financial planning, right? Job security, if somebody is sacking you, I'm assuming in this situation this is not in your control, right? Second is financial planning. Now, most of us burden ourselves with a lot of financial thing, like, getting an apartment in like a gated community, which could be like 2 crores or whatever, right? And, you always, so I think financial planning, there are no enough financial consultants in India. A lot of people do it by themselves, right? They'll be like, okay, I draw 2 lakhs salary. Now 1.2 lakhs will go for the house loan and 80,000 is enough. You never prepared that what if I don't get a 2 lakh salary? What if I'm sacked or my salary has gone back to 1 lakh? Then how will I survive? So I think financial planning is very important. I think lifestyle is something that we'll have to curb a little bit and see what are absolutely necessary, what are not absolutely necessary. And don't worry about if you're living in a great place or not, if your child is going to the international school or not, right? I think at the end of the day, you living a less stressed life is much better than having a child going to international school, or you living in a particular network of, like housing situation or whatever. Yeah, that's important.
Hello, sir. Good morning. Yeah. Like in our daily routine, we have very much work stress. So we both used to travel to jungles for a change, do some safaris. Yeah. And now, because we both love to being in a nature. So like now I can't travel. So in home, I ask my husband, he's very good singer. So sing some songs and play some musical instruments. So that baby also inherits those skills, and I'm also, my mood will be fresh with those activities.
Okay, that's wonderful. Yeah. But please don't think that you can't travel. If you like nature, you can go to KBR Park. I'm just saying, it doesn't always have to be that thing that you do. You can do the next best thing. don't be all or none. Like you can still go to KBR Park. I think it's a wonderful place. You have peacocks. You can sit there for some time. There are some, I think, some areas for meditation also. You can go and sit with your partner. Maybe he can sing there.
Yeah, I have a question actually. I observed so many people in this situation, pandemic situation. So some people feeling health stress, like they don't have any issues with health, but still they feel stress. Like that, I have some pain in my left side or right side, so I can feel stress. Oh, definitely.
Or combination of both, right? Yeah.
Hi, sir.
Hi.
How to deal with peer pressure at every stage of life?
So is the peer pressure self? Like I think I'm traveling. I'm gonna obviously cut down on some of the dietary habits. It's about coming to the solutions. Yeah, yeah, but well said. Yeah, yeah.
We're running late.
The stress buster. You can't be like I'm working or I'm at home taking care of things. What is talk about exercise? Very, very, very important. Working out in the morning, especially in the morning, not in the bedtime. During the bedtime, working out in the morning is the most important thing. At least 30 minutes, right? Any kind of exercise. And staying physically active. It's not just that half an hour.
That's Dr. Charan. Please put your hands together. A big Hyderabadi clap. Thank you so much, sir. It's so pleasure having you this morning. I think everybody loved this session. Yes? All right. Thank you so much, sir. It's such a privilege to have you this morning. And we have a few more dignitaries here. And without taking any more time, I would call upon Dr. N. Rohini Priya Lakshmi Garu on the stage. Ladies and gentlemen, please put your hands together. We have this wonderful person who is the HOD of Operations in KIMS Cuddles, Kondapur, and Dr. N. Rohini Priya Lakshmi is having 10 years of experience in providing health education and diet. All right,
Nobody.
Once a day only. Once a day.
Sensations will be there, and you will be tired. If it is a primary, you won't take care of your oral health also. Just I want to go through with this. To sustain oral and go back. Sustain oral and dental health for a lifetime, effective and adequate care is essential. Pregnancy, a dynamic and most important phase in a woman's life, is mouth dryness is the most common thing we'll use to see, and dental erosions. Yeah, kind of, and back tooth has to be in a circular motion only. Dental cavities, interdental gingival enlargement, because you should not do more of interdental flossing and all without consulting dental doctor. If we people are advising that you can go for the gingival thing, then only you have to do interdental flossing. By your own, you should not do all those things. These are the things how our teeth is getting spoiled during bacteria and byproducts, endotoxins, lipopolysaccharides, whatever you are taking your food things. Whenever you are taking any sweet beverages, you have to rinse your mouth. I'm not, but you won't maintain. I know because I am a mother of 2 children. So definitely I didn't maintain that. So you people also have the same thing, but you have to maintain that carbohydrate levels also, what food you are taking, in which quantity you are taking, you can take that. Vomitings like acidic environment, it's okay. Importance of nutrition and dental health, because whatever food you are taking, that is the main thing you will see in the pregnant woman. That anyhow tomorrow Dr. Priyadarshini is going to take class of how diet it will affect in your daily thing, and for pregnant woman how you have to take food also. Oral care recommendation during pregnancy. Now you are brushing for 2. Hope you all will do from today 2 times. I'm hoping for that. Gum disease and cavities will be there. You have to check your dental checkup. And you definitely after once you get the kid, you will be pretty busy. Then you have to go at least thing. And the second trimester is ideal to carry. No, that's why I'm saying that if you are having any dental issue in second trimester, if you are in a 5th month, it is a safer time, you can go for it, because all the teeth won't go for the extraction, like removing of the teeth. That we can prevent with the filling. If you are having a bad pain, then it will go for the root canal. Like that way we can protect. If necessary only, we'll take a radiograph. That is also IOPA will say. Yes.
Hello, ma'am.
Yes.
Are teeth aligners safe in pregnancy?
Teeth aligners. If it is that is not most important. Already you have that gingival problem will be there. So you can plan after your baby comes out. Because you may have that time you will have that discomfort will be there and you have pain in the gums will be there. So during pregnancy aligners is not the important thing we have to do it in the pregnancy. That you have to plan before or once baby comes out. Like in pregnancy, most of the things we have to see is if you are having necessary for the treatment, if you are having more pain, you are not able to tolerate, if you are having cavities, that things we can do.
Thank you.
Okay, we'll go for the questionnaires.
Good morning, ma'am.
Yes.
Ma'am, actually from previously onwards, I'm having issue like sensitiveness in my teeth. So I visited one doctor and he suggested me to take some Sensodyne's toothpaste. So whenever I'm using it, it's okay. But suppose I want to switch to a simple normal toothpaste, again I'm getting the same issue again and again.
That's what I'm saying. We are having 3 layers on the teeth, like a enamel, dentin, then it's a pulp. Pulp is nothing kind nerve. So because of our brushing habit, nowadays we are having in market so many toothpastes are there. We are using that. Already spoiled is spoiled. You have to maintain with sensitive paste and you have to follow the soft bristles brushes. If you are doing with the night time like a warm water salt gogglings, that will help you a lot.
Thank you.
Sorry. Do eating sweets can cause tooth decay? 1%. No. 1%. It's absolutely no. The lady in orange sari. Raju. Next question. Next. Decayed tooth will affect people's work or other aspects of their everyday life? In which way? You are having any decayed tooth? Okay, all right. Decayed tooth can make people look bad? It is yes only, because if you are having any cavity in the front part, definitely if somebody is looking you, definitely the persons will see our smile first. 60% of the people will look into our teeth, then our eyes, then our features, then our how we are dressed up. Okay? So if you are having any cavities, you have to go for the treatment. Should every painful tooth be removed? Sorry. Yes, we are having so many ways to treat the teeth because once in milk teeth gone, once we get the permanent teeth, we have to protect those teeth. Once it's gone, is gone. We have to in all the ways we have to try to protect our teeth because back teeth is for mostly for chewing purpose.
Yeah,
And you what else? You are facing anything issues or just you are?
I'm not facing, but I'm aware of that.
Okay.
So I'll be
All right, good. In that part, you have to go for the cleaning. If it is necessary, we'll see. After seeing a dentist only, you will come to know what we can take care of that particular person. Do you think bleeding during tooth brushing indicates gum problems? Yes. That's why I'm saying about how you have to brush your teeth. That's why all the ways whenever you are doing your brushing, you have to take care of how you are keeping your toothbrush. It should be in a 60 degrees angulation, and back tooth it should be in a circular motion. Front teeth it should be like a front and back. Does pregnancy increases the tendency for your gums to bleed, swell, or become red? Yes. You have to take it during that time. Try to do warm water with salt garglings in the night. No mouth washes is prescribed for the pregnant woman.
No mouth washes, sir.
Brushing teeth with fluoridated toothpaste help to prevent tooth decay. Do you regularly change toothbrushes? Yes. I want to know how many days or months. Ideally is 3 months. Thank you. Are you aware of any other oral hygiene aids? No, it's not prescribed. No, without dental advice, you should not go for the flossing also. Just you have to do it with warm water and salt garglings only. No, you should not. Is oral health important to general health? Do you know there is a relationship between oral health and pregnancy? Can poor oral health affect unborn baby? Do you regularly visit the dentist? No, I know everybody is not visiting. You have to visit. Anyhow, we are distributing the dental coupons for you people all. You can come with your family. We'll see how you people are. And we are going to pick one lady for giving Mrs. Smile also. And we are giving coupons like for you people all. You can visit this coupon.
So we KIMS Dental Group, Dr. Prathyusha, Dr. Prasad have given us some coupons. This is a dental voucher which gives the pregnant lady for a free checkup and treatment worth of 500. And you can avail this coupon the entire coming week. You have to go to KIMS Dental, which is in Block 1, second floor, dental department. Once you show this voucher, you will not be charged. You will have a free dental checkup. And as a part and parcel of free dental checkup, they will identify if there are any issues. And they are the ones who will give the entries to the finale round, the 10 entries to the finale round, the 10 people finale round. So it is very important that you go, show your voucher, get your dental examination done, and then you should give this voucher there. Don't forget to give your voucher, carry your voucher, and carry your badges also. Okay?
Thank you, ma'am.
All right, I think you should put your hands together for that lovely session. Thank you so much, madam. Thank you so much. And next we have is Dr. Navya Chowdhary, madam, to kindly come onto the stage. Ladies and gentlemen, please put your hands together for Dr. Navya Chowdhary garu. Thank you so much. We are so happy to have you here this morning, ma'am. And the small honorarium we have from you, from Dr. Keshal Garu. So please put your hands together, ladies and gentlemen. A small token of love and small honorarium from Cuddles' mom. Thank you so much, madam. This morning is to you. Over to you.
Hi everyone, I'm Dr. Navya. I'm a dermatologist from Sasha Lux Dermatology and Cosmetic Surgery Center. So today I'm going to give you some basic dermatologist tip for super moms to be. So now we're getting ready for the baby, pregnancy, childbirth and beyond. So pregnancy is a very beautiful journey and as well a roller coaster journey in a woman's life. So apart from the body changes, there are a lot of skin and hair changes also that happen. And also like your mood changes, all these happen very rapidly. Morning sickness to dietary changes, skincare woes, your everyday life starts to follow a whole new routine. So hormonal changes can affect, like when you're pregnant, the hormonal changes can affect the skin color, may darken a little, either in patches or all over. Your birth marks, moles, freckles may also darken. In addition, most women develop a dark line in the middle of their stomach. I'm sure most of you have noticed. That's called linea nigra or commonly the stretch marks. This will gradually fade after the baby is born. But as you know, once the skin stretches, it never goes away completely. Hair growth is also increased during pregnancy because of hormones and your multivitamins. And your hair may also be a little greasy. And after the baby is born, most of you start losing hair. And don't worry, it's called telogenic effluvium, which is stress induced. And also your vitamins and all, you're lactating, right? So most of your nutrition is gone to the baby. And then your hair doesn't get enough nutrition, and that's why there is a lot of hair fall. But that can be corrected with your postpartum vitamins. So here are some of the common concerns during pregnancy and post-pregnancy. First and foremost is pigmentation. I'll just give you an example. So when my co-sister was expecting with her first child, she had developed a lot of pigmentation. Like she was easily 3 to 4 shades darker than what she was. Her neck was extremely dark. And like after her like when I met her after about few months of her pregnancy, then I asked her, what are you using your sunscreen and all? She's like, no, I'm not using anything. So by using, and then for second pregnancy, physical sunscreens are the same sunscreens we advise to kids. And also after your baby, first 6 months, we do not advise sunscreen because, so the whole science behind applying oils or creams or anything is to keep that area moisturized. So when your skin is dry, this happens more. When your skin is well nourished and moisturized, let it be your oils or your creams or anything, a basic moisturizer also, the stretch marks will be lesser and obviously weight gain. If you gain a lot of weight, then obviously your stretching is more, then the marks are more. So try to eat healthy and gain the appropriate weight needed. So during pregnancy, our elders generally start telling you have to eat for 2 people and only then the baby will get enough nutrition. That's not true. There's a very little portion and that's more than enough for the baby. So the baby takes up what it needs. The mom will have the deficiencies and all, but generally the baby takes up whatever is needed. So you don't really have to eat for 2. The next one is blood vessel changes. So the changes related to blood vessel, there's redness that you notice. It is very norpaline. We generally advise you not to apply these during your pregnancy. The only safe ointment ingredient during your pregnancy is only a clindamycin, which is just an antibacterial ointment. If you have pimples, just apply it on the pimple spot. That's it, nothing else. The next one is skin rash during pregnancy. It is a very, very common one. So the skin becomes very itchy and which is quite irritating. It's due to basically the transport of, it's because of the impaired transport of bile to the liver. And this bile that's there secretes all over your body, which can cause a lot of irritation. So for this, again, just moisturizing your body. A lot of times a simple itch can be just cured with a moisturizer. So if you moisturize well, your itching sensation automatically comes down. Next is hair pattern changes. Changes in hair pattern that follow pregnancy are typically the result of either hormonal fluctuations or telogenic effluvium. That's stress related again. So as I told you, initially there's good volume. It's because of lactation where the baby takes up most of the nutrition, and also you're not sleeping properly. You have a lot of stress. It's a newborn. Safe treatments during pregnancy. So first, no is any kind, not only when you're pregnant, but even when you're lactating, we generally do not recommend any kind of laser. Let it be even something as simple as laser hair reduction or your pigmentation lasers, nothing to do with lasers. There is a lot of documentation now that's saying that it can be done during lactation, but still we don't want to take any risk. So generally it's better to wait till you completely finish lactating. And if you want any facials, the safest facial would be, I'm sure, zinc supplements are also safe during pregnancy. Zinc is also given when you're having a lot of breakouts. Next one is the sunscreen. As I told you again, it's a physical sunscreen. It's generally the titanium dioxide is completely safe during pregnancy. And has produced. So again, leading to more acne. So don't overwash. Just 2 times a day with a gentle cleanser is good enough. Moisturize. In case your acne, now it's winter, so I would recommend something a thick moisturizer, but even a lightweight moisturizer is also good enough in case you have acne-prone skin. So always keep your skin hydrated. This is a key for anything. Let it be your anti-aging, let it be your pigmentation, open pores, anything. Moisturizing is very, very important. Next is protect. That, as I told you, is a good sunscreen, a physical sunscreen. Next, and a lot of people also talk about double exfoliation, washing your face twice, with the exfoliation, scrubbing and all. So exfoliation is recommended only weekly once. The St. Ives thing is super popular and people use it like left, right, center. But it's not very safe. Weekly one scrubbing is more than enough, because anything, if it has granules or something and you're constantly scrubbing on your skin, it's irritating your skin. So this can cause something called irritant contact dermatitis, which can cause pigmentation, which can cause dryness and your pores and all that. Next, coming to your hair care is wash your hair twice a week. Ideally, every third or fourth day, you can use a shampoo. You can wash. Overall, it helps support your health and your skin too. Drink plenty of water, and
once a week or once in 2 weeks. So is it still safe to do? Okay,
Yeah.
and just one more question. So we usually have the habit of doing home remedies, right? Like be it vitamin C, lemon pack or something. Can we still do that in pregnancy?
So lemon is something we don't really recommend, because lemon is a pure form of vitamin C. It is not, whatever vitamin C's we do, they're all toned down. They're not very raw. So generally we don't recommend, because lemon can cause photoaging. Suppose you apply lemon on your face and then you have now anyways we're not going out in the sun, but even computer and all, these are all source of UV light, right? That can cause pigmentation. So that's why we do not recommend.
Yeah, thank you.
Hello, ma'am. So, how about a hair color?
Hair color, no. We do not. So there also an alternative to this is vegetable colors. Even forget about pregnancy now, even people who are not like normal people also, we do not recommend hair colors, because it can cause a lot of pigmentation and melasma. So if you see somebody who's been using hair color for a prolonged period, like your mom or somebody, they generally develop this kind of patch. That's because of hair color. Most of them do not realize that the hair color causes those fumes which cause that it irritates your skin. So vegetable hair color like Indus Valley hair color is something which is very safe. And there are also a few other hair colors like Cutis and Silky. These generally you get in medical stores. So these are very safe during pregnancy.
Can we use natural henna powder like
Yes.
directly with mehendi?
Yes. But after henna, what happens is your hair can get very frizzy. So you have to oil it properly at least like a couple of days after you do it, and then your hair gets normal.
Thank you.
Hello, ma'am. I have heard from many people like there will be a lot of hair fall after postpartum. So, I mean, what's the reason behind that? Is that really true?
Yeah, it is very true. It's called, there's a term also called telogenic effluvium. So after pregnancy, after you deliver, all your hormone levels are going to dip. Right, and also your energy levels. You deliver a baby; it's a very stressful condition in your phase, right? So what happens is your vitamins, everything comes down, and suddenly all these 9 months you're on your multivitamins. After delivery, most of us neglect. We do not take our multivitamins, and now you're supporting another baby for the next 6 months, because the baby is going to live from you, right? You're lactating the baby, and that's how the baby is going to grow. So imagine all the essential nutrition is going to the baby. And suppose you have some amount of, suppose 180 is generally a good value of vitamin B12 medically. But for good hair, we want it to be above 350, because what happens is whatever amount of vitamin B12 is there, that is taken up by your important organs like liver, kidney, they have functions to do. So whatever is left actually goes to your hair. So most of it is used, right? So that's why your hair is the first thing that starts showing whenever you have any deficiency. So it's very true. It's because of stress. You don't sleep. You're lactating the child constantly. So your whole body undergoes a stress called oxidative stress. So because of that, there is hair fall. There's a lot of hair fall actually. It lasts for about 6 to 8 months, and then gradually it gets back to normal. The hair fall stops. So the only solution to this is taking your multivitamins. The post-inflammatory the acne which has left marks, right? So ascorbic vitamin C is completely safe. Azelaic acid really helps. So and niacinamide, these three are your go-to ingredients. These three actives can be used, yes. So during you're expecting, right? So during pregnancy, what happens is there's a lot of oil gland secretions. So it is you'll also notice a lot of hair growth. Along with that, greasiness comes in as an extra thing because of the excessive oil secretion. Unfortunately, there's nothing much you can do because it's a lot of one of the reason why you're getting foot cracks. So there is not one of the reason why you're getting foot cracks. So there is normally we do a urea application, but again for pregnant women we do not suggest. What the best way to do this is apply. There's another drug called melatonin, which is commonly prescribed, but again, the data is not sufficient to say that it will definitely slow. It doesn't reverse. Nothing reverses the process of graying, but for exposure and where not many people, the blades and all should be sterile. Yeah, so I think after 7th month, it's safe. 9th month is generally what we do because the baby is a little bigger and it's more safe. So after pregnancy, first thing is we don't. So a few years ago, a lot of people were using olive oil for massaging, right? So now olive oil is not really recommended for babies. So a lot of people, whoever are planning to massage, I mean, you will massage the baby once the baby is born, right? So no to olive oil strictly. Instead, just use, if you can, fresh, cold pressed coconut oil is something which you can use. Yeah. No, almond oil is also absolutely fine, but strictly no to olive oil.
And this would be
and
last
for
question.
yourself,
Sorry. Yeah, last question. In the interest of time, one last question because we have a lot of other things to do. So yeah, please.
Moisturizer, you can, if it's a combination, then I would suggest you can start using this Nutriderm Vitamin E moisturizer because your dry skin will get moisturized, but your oily skin, there won't be any acne development. So it's a very safe moisturizer. Nutriderm Vitamin E. Yeah. So in makeup also, the safest brand to use makeup is Clinique. Okay, so that's one thing that you can use, and also keep changing your makeup brushes and all frequently. From when you get pregnant, just buy a new set of brushes. Don't repeat the old ones because these brushes can have a lot of bacteria and all.
Yeah, this is last question. Because after this, we are not.
By Bioderma is something that's completely safe, and Mustella is something which you can use. But again, if you go back to summer, you need something which is very.
Ladies and gentlemen.
From past many days, we have been Mansa is coming in these functions, but unfortunately she's not well. That's why I had to be here. But even then, that was quite informative for me. And first of all, let's do a small exercise as Sir Isaac used to do. Whoever has come with her husband, could you please turn towards your husband? Look into his eyes. Now repeat all the wonderful husbands. बहुत खुशी हो रही है. You are quite an inspiration to some useless husbands. Okay, and volunteers. Here I have. Sir. Yeah, why not? Let the world see you. What's your good name, sir? Sandeep. And where's your partner? Teja. Okay. So today on Men's Day, I would request you to sing a beautiful song in front of all of us. At least 2 to 3 lines. And that will tell you. Yeah. Alright, first of all, please. Yeah, please. But I just want to ask, were you under some sort of pressure? No? That was from heart? Yeah, I believe that. Yeah, please.
పొరిగింటి మంగళ గౌరి వేసుకున్న గొలుసు చూడు.
I hope you're not abusing him.
No.
All right, lovely. Thank you. Okay, yes sir, yes sir, yes sir. Ah, what a handsome man. So, what's your good name, sir?
రాస రాస నువ్వే నేనని నా ఊపిరే నిలిపావురా నా కళ్ళలో నిలిచావురా నా ప్రేమనే గెలిచావురా మనస్సునే పిలిచావురా నా లోకమైపోయావురా వెయ్యేళ్ళు నాతో ఉండరా
क्या बात, क्या बात. Should I talk to your parents for this guy?
He's there,
Yeah.
coming by himself. expressing
Anything
this
you'd
love
like
all.
to convey 2 or 3 lines?
I just want to say thank you.
Please,
Thank you.
Be seated. Be seated, please. Be seated, please. Relax.
It's just this, even after his long night shifts, he comes here, attends his events with me, and even looks after a 4-year-old. And he's been very supportive.
बात बिगड़ जाए जब कोई मुश्किल पड़ जाए मैं दूंगा साथ तेरा ओ हम नवा न कोई है न कोई था जिंदगी में तुम्हारे सिवा मैं दूंगा साथ तेरा ओ हम नवा हो चांदनी जब तक रात देता है हर कोई साथ मैं मगर अंधेरों में हाँ दूंगा तेरा साथ जब कोई बात बिगड़ जाए
Rachna.
Rachna.
हाँ जी. Ever since the starting of the pregnancy, it's all about me. But I would like to say that a small part of credit goes to the husbands also, because husbands नहीं होते तो आज हम इस zone को enjoy नहीं कर रहे होते. So thank you so much for being with me in every phase of the life. Thank you so much.
I can see tears in Bhai Saab's eyes. You want to say something, sir?
Yeah, a little bit just that. Thank you for always being there for me. And हर जन्म में मिल जाना जल्दी.
Oh my God, हर जन्म में. No, expressions are not meeting whatsoever. Lovely. And I can actually see tears in his eyes. Yeah? He is getting emotional. Oh man. Big round of applause for sir. See. Now he is making me emotional. This is the love. Actually, you know, आप लोग जब आप लोग की डिलीवरी होगी, जब भी आप लोग मम्मी बनोगे, इसका आधा श्रेय तो आपके हस्बैंड्स को मिलना ही चाहिए. And first of all, I'd like to request everybody to please give a big round of applause to your husband there. I'm a feminist as well, man. Don't worry. Yes, sir. Are Kalin Bhaiya is here? Wow. What's your good name, sir?
My name is Rishabh Jain.
Rishabh.
And I also want to sing a song for my lady.
Please go ahead, sir. Go ahead.
So, since my Radha has become really lambiya, so this is for you. तेरी मेरी गल्ला होगी मशहूर करना कभी तू मैनू नजरों से दूर किथे चलिए तू किथे. Thank you.
Lovely voice, sir. Lovely voice.
Thank you.
अच्छा आप जब झुके मुझे लगा पैर भी छूने वाले हो.
आज तो नहीं बनता ना, आज तो मेंस डे है.
नहीं वैसे ही बनता है, ऐसे हस्बैंड को हमेशा बनता है. But lovely voice. Please give a big round of applause. Please give a big round of applause. Ma'am, anything you'd like to say?
I'm not a good singer as him, but I would just like to say, जाने क्यों दिल जानता है तू है तो I'll be all right.
Thankful to him because being a very busy person, he went to Pune also to work. But today for this event, especially to attend this event with me, he came here. I am really thankful to him for being supportive to me.
He loves you a lot.
Yeah,
I can see in his eyes.
Thank
you.
you.
Is that for her or for me?
Definitely for me.
All right. Thank you so much. Thank you. And now we'll continue the session. बीच में हम फिर से मिलेंगे आपसे. Okay?
Thank you so much. Thank you so much. एक बार जोरदार तालियां हो जाए. Please put your hands together for the lovely time of recharging and some time of fun and some time of. I could figure out so many wonderful singers are here this morning. Everybody has some great voice. And without taking any more time, it's my minutes. 10 minutes is only 10 minutes. And somebody has got their valet parking card. I think you kept it aside. Okay, you didn't throw it, you didn't forget it. You just gently kept it aside and somebody thought you forgot it and gave it to me. Please collect it from me. It's it's 04. 04 is the card. 8254 is the registered number, whatever it is, okay? All right, please collect it accordingly, all right? It should be the valet parking card if you have put it aside. So you can collect it at the podium. Thank you very much. 10 minutes have been already started. You're done with 60 seconds. So last 9 minutes is what you have. Please quickly have a bite and come inside. 10 minutes is only 10 minutes because we have to cover a lot of things. Thank you. Check, check 1 2. All right, moms to be, dads to be, please. It's time. It's more than 10 minutes. We have been gracious enough. Even after 10 minutes, now it's time that you have to come inside. You can walk inside with your plates. That's okay. If you have a plate in your hand, that's absolutely fine. You can walk inside with your plates. Friends outside the hall are requested to kindly come inside. We are starting this session. We don't want anyone to miss on the important session, so we want everybody to kindly come inside. If you have a plate in your hand, that's absolutely fine. You can come inside. Last and final call for friends around. Thank you. Check 1 2. All right, last and final call. Now we are starting now. Okay, we are starting it now. So if you are coming inside after some time, so don't hold me responsible. So you are responsible for yourself. Moms and dads, last and final call. Last and final call. If you have a plate in the hand, that's absolutely fine. You can come inside, start having whatever you want to have, but please come inside and have it because we are starting the session. Ladies and gentlemen, without taking any more time, it's my pleasure and privilege to call upon MS Radha Dabriwal. Ladies and gentlemen, will you all put your hands together for Radha Dabriwal? Thank you, madam. Thank you so much. We are so happy to have you, and there's an honorarium for you. All right, and this is from KIMS Cuddles. Please put your hands together. And Ms. Radha provides counseling services for a variety of emotional concerns, and she specializes in working with parents, adolescents, and women. She's passionate about women's mental health and parenting, adopting a trauma-informed approach. She has a keen interest in working with emotional issues and provides a safe space for unfolding of your emotional landscape. Therapy is a journey towards a more authentic, healthier, and happier life is what she believes in. Without taking any more time, I would give it to Ms. Radha Dabriwal. Thank you, madam. Thank you so much. Once again, a big round of applause, Hyderabadi style of welcome to Radha Dabriwal. Thank you.
Hi, good morning, everybody, or should I say good afternoon. I hope everybody's doing well and everybody's refreshed after the little break. My name's Radha Dabriwal, and I'm a counseling psychologist. I work primarily with women's mental health, adolescents. So before I begin the session or before I start the talk, I would want to do a small activity with all of you. Is that okay? Yeah? Cool? So it's just for us to feel a little bit more present. So all I want you to do is just relax, get comfortable, get into like a comfortable posture, just like ease out. Yeah? If you want to keep your eyes open, you can. If you prefer closing your eyes, you can do that too. Right? So just relax, focus on your breath. I just breath in and release. And as you release, I want you to let go of all the thoughts, all the worries, and just focus on the sound of my voice. Just breathe and relax. Now, I want you to treat your ear like a radio. I want you to focus on the most distant sound that you can hear. Something outside of the room, as far as your hearing can go. Focus on the most distant changes which are happening that creates a lot of emotional turbulence. You might have mood swings, things that it's your own expectations. What did you think your pregnancy is going to be? What did you think your life's going to be at this point of time? What's your mental health like? What's your emotional health like? And with this, you have to manage your normal day-to-day life also. Your work doesn't go anywhere, right? Candles in front of you, and you have to blow them all out. You know, the way you would blow, you literally huff at those candles, like with all your strength. And I swear to God, like that really releases all the tension from your body. Okay? Once we have this basic structure, basic way to work with our breath, then we can do certain more like structured breathing exercises. I've shared one example, which is a box breathing. Okay? It's just like, imagine there's a square. We start from one corner of the square. We breathe in for 4 seconds, hold for 4 seconds, breathe out for 4 seconds, and then again hold for 4 seconds, right? It's a very simple technique, and you can do this at any point of time. No, you just catch the one that is yours, right? Similarly, you don't have to hold on to every thought that comes into your head, right? Just a second, I'll just have some water. Sorry, my voice is cracking. Right. So that's what mindfulness is. Just paying a little attention to our breath, listening to music, just being present. The little tuning in activity that we did at the start was also a mindfulness activity. Okay? Next. So this is like the last bit where I'm just going to tell you a little psychologically proven ideas for mental health which you can accommodate from today. The first is to maintain a simple self-esteem journal. Okay? It's nothing but just like at the end of the day, you know, in that winding down 1 hour or half an hour, just write down something you're grateful for in the day, something you did good in the day, something you are proud of in the day. Okay, just give yourself credit. There might be days when you don't feel like getting out of bed. But even if you did, even if you just took care of yourself like 5%, give yourself credit for that. With that journal, write down one thing that you are to look forward to the next day. So you end end the day on a positive note, and you're already beginning the next day on a positive note. Okay? Listen to music. For me, that's my stress buster. Music really helps. Art really, really helps. Sometimes when you're having any emotions or having multitude of emotions, just take a sheet of paper, take paint, sketch pens, crayons, anything, just draw it out. You don't have to create a Picasso painting. You don't have to show it to anybody. It's just for you to release your emotions. And trust me, it really helps. Or you can just put on some instrumental music, take a crayon or a color pencil or a sketch pen in your hand, close your eyes and just it out. I know that therapy is a taboo. People think that, oh, if I go to therapy, there's something wrong with me. Oh, only mad people go to therapy. Please, no, please. You are all catalysts of change. Understand that a therapist is there just to listen to you. Have that self-understanding. When you have that self-connection, you'll have more love for yourself. You'll have more compassion for yourself. Right? And ultimately, when you have that happiness inside you, when you have that calm inside you and that love inside you for yourself, you will be able to give that 100-fold to your child. And that child's going to learn from you. Assuming it is, yeah. So of course, I can understand that it is scary. And it's okay to be scared. So the first step is for you to just accept that it's okay to feel this way. Right? We tend to compare these people had it so easy or these people did it so. Is it the whole act of it that's scaring you? What is it? Worry and psychology. Get them excited about having a companion. Tell them the beautiful times where just make sure you're present for the child, or you come and hug the child, and please be very physical with your love. As many kisses, as many hugs you can give the child, the better it is. They feel that love from you then. So to answer your question, just communicate and try to take out undivided attention for your child, even if it's this thing for 1 hour, half an hour, and communicate that to your child. Cool.
Salary. Nobody is going to get salary just like that. And then you are going to get it. So these are the kids. Over the time, what is going to happen is probably they might not able to take that much of stress, and this is happening. Probably your juniors, they might call you, sir, I'm not able to take a stress. So this is the way. This is called as a millennial parents, because we are in between the two generations. What are the two generations? First generation is our parents. What they taught us? Strict parenting. Strict parenting in the sense, I would not say strict means you beat your child, but strict is there are principles. Okay? There are certain principles, and we all are product of the conventional parenting. You can't beat them. So this is kind of we are changing from conventional, but you choose the one. But you have to consistently give. He is the boss of the family. He takes maximum, which is really important is independence. How many of you are giving independence to your child? What kind of independence we think of dry fruits? Can we give chicky? Can we give peanuts? So I said, yes, it's good, jaggery and all those kind of stuff. But now what is happening? Everything is available, accessible. So why they are not eating? Why? Lot of options, but it depends upon you. You are giving options or not. That okay, he don't want to study for the 5th standard, let's him put him the 2nd standard, it is easy. Why not? Why not? But always in the food we do the same thing. Yes, he's not eating food, let's give a milk, let's give a juice, let's give these things. Why I'm giving this OPD? They are not eating, can you give some medication which will make this child is crying. Keep on shaking them. When once he is one year, 13, 14 kg, he is expecting the same thing. And then mother comes, oh, he's not sleeping, I'm completely exhausted and all those things. Why? You only did that. And there is a second set of parents. He doesn't eat, sir. Always he's eating pizzas, junk food, whatever, bread, chips. I said, where your child works? He said, no, his child, he doesn't work. From where he's getting money? No, sir, we order for him. Then who is the culprit? Who is the culprit? Parents. Who is the culprit? So accessibility is a problem. Initially, like 10 years back, if you wanted to eat an ice cream, natural ice cream, we have to go there. We have to plan. Saturday evening, we'll go and eat. Now, you will get a 1 scoop of ice cream, cold ice cream at your home. So accessibility. So make it sure that you don't make this. So all those things is gonna, the kids are getting really problematic. Today only I had a talk in school. The kids are going in a different direction, let me tell you. So you have to make it sure you have to reset yourself. What exactly happening? There is so much of knowledge, there is so much of artificial intelligence. And remember, nowadays, convenience, the kids' convenience, they call it knowledge. Convenience means what is accessible on the Google. It's convenient, they will say this is a knowledge. But this is not. What is the knowledge is a process. It takes a lot of time to assimilate that knowledge and make it into actually a mindful knowledge. So, first of all, I wanted to tell you is, during the parenting, let me tell you, this is definitely stressful. As a father, I'm telling you. I can say I have enjoyed with them, I play with them, I fight with them, I'm enjoying it. But if you're expecting as a father, the first day would be really amazing, no. Why I'm preparing you, I'm being truthful with you as a father. And I think so everybody accept here, including everyone, like whoever has given a talk, I accept. The first day, when you come out of the labor, you are exhausted. Okay, father is preparing since last 9 months to be a father. Mother has a baby, definitely. She has that, she developing that emotions, but father, one day, this is your baby. Okay, so then now he has to think, oh, baby, okay. So, finances, then diapers and all those things. So, what I wanted to say is, it's a process for both of them. I'm not advocating fathers, but it's a process for both of them. So, it's not it will take some time. You learn, okay, how to handle your responsibilities, whether you're going to go for some parties or not, and all those things will change. So, it's a process. So, it's definitely stressful. But the most important thing is, you start enjoying this stress. It's worthwhile. It's worthful. Our parents had a lot of stress to raise us. They enjoyed it. So, enjoy. And remember upon two things. I said there are only two things important in the life, and just be very clear about it: health and education. Make it your child is healthy and is well educated. All other things are byproduct. You make it salary, degree, mindfulness, patience, and all those things. You learn from it. And your job is only two for your kids. You feed them properly, discipline, feed, and protect them. Other things they will develop. And be a good role model. Good role model means like you don't have to be the best father, but you have to do best for your child. Means they learn from observing you and all those kind. This is correct, true. They learn a lot of bad things from us also. I absolutely agree with you. But there is always a process of de-learn, and which can start on the day one once you realize they are learning in a different way. So parenting is beautiful, but definitely it's stressful. But start enjoying. It's worthwhile. It's worthwhile. So don't start the journey as it's going to be really amazing, everything will be fine, the way they shows. Okay, it doesn't happen like that. It's like sometimes what happens is mother is having some medical issues, they are exhausted, the child comes in, doesn't feed, fussiness, all those things happens. So don't feel, this is a part and parcel of a life. So don't feel that, oh, why it is happening with me? It didn't happen with my friend. She was so easy, the baby sleeps nicely, my baby crying throughout the night. It's a process. So parenting is definitely, and make a strict rules, make a hierarchy system in your house. Whatever it is, behind the curtain I said you discuss, but make a hierarchy system, because they will always find, if anyone says to those kids for playing there that, okay, go and play, they will not say, but some person who's kind of I'm there, I'm sitting in the front, I said, oh, go back to your chair, mother, and sit there, they might accept, because they know that here, there is one person who's speaking in front of everyone, and everybody is listening. Most likely he is kind of in the higher hierarchical level. And they are smart. They are absolutely smart. Give them an opportunities to the kids. Absolutely smart. If a small child in the sense, let it be a 6 month, 7 month old child. And if I give a small ball or a big ball, what ball will they will accept? But nobody taught them, 6 months, this is big, this is small.
Whatever, they can hold, they'll try to grab.
So this is a I don't have an explanation. One point of time, which most of us can't do. Till 6 years of age. So don't feel that they're having a less brain potential. It all depends upon you, how you can embark them. Okay? So remember this kind of a principles to go ahead, be disciplined. This is really important. Okay, take care of them. So we remember, feed and protect them. So always we should protect them. All those things now they will start developing by themselves. Give them an opportunities. Make it sure that the biggest thing we are going to face over the time is a food. Let me tell you very clearly. All of them are going to have, because the food pattern is changing. It's absolutely changing for all of us. And it's really a bad diet we are having. So that is one thing, and education is really important. I'm happy to answer a few questions or many questions. Yes.
Do we need to wait till the child feels hungry? However long it is?
Yes. So now I'm not talking about a small child. Let it be a very small baby, just born baby. So there is a protocol. Like protocol means every 2 or 3 months, 3 hourly you feed. If the very baby is small kind of a thing, then probably you try to wake the baby and feed it. But most of the time, make it sure that you are not disrupting the sleep. If the baby is feeding very nicely, eating nicely and sleeping, you don't have to catch hold of him. Ultimately, what do you want? By the age of 1 year, what do you exactly want? You want them to follow your same pattern. Yes? What you are eating, lunch, breakfast, dinner, and all those kind of stuff. Okay? So you make it sure that this is kind of a discipline. Yeah. Good. Yeah, please.
So talking about the parent-child relationship, one question is, recently I'm observing my kid going, whenever it's time to sleep, he goes to his grandparents' room. Now, over a period of time, I'm starting to feel that I'm missing out on him. After a day-long work and my husband and we come back, so I thought he should spend more time with us, but that's not happening. And expecting a second child, I don't know where this will go. So how to manage or how to even explain them that yes, we need that time with our kids.
Okay. So just think, definitely happens in the, I would say, not like a nuclear family, but the joint family where the grandparents are there, because they are accessible, they are available. So they feel more connected with them. So it's all about accessibility and availability. So here, actually you can't, this is again an expectation from the parent that the baby should come back to you. So rather than that he should come back to you and ask you, what you do is, you actually, once you come home, refresh and say, let's play a game. Or let's get for a walk, or let's go for a cycling. So you have to give an indirect message to the child that I wanted to get involved with you. And once he started playing, once he starts cycling with you, game with you, interaction with you, then he'll come back. Next time, after 1 week, he will come back and say, can we play that game? Can we play that game? So this is the way you start developing these things. But you have to invest. You have to invest. If you won't invest, it will not come back. Whether you are very rigid parents or whatever it is, if you have invested nicely, it will come back. At the end of the day, it will come back. That's why they're following the hierarchical pattern. That's why I'm telling you, there are a lot of parents comes to me that my kids is not like following this pattern. Why? There are grandparents. If I scold, if I try to be strict, they come back and they said, oh no. No, you don't have to, there is no negotiable thing here. If it is wrong, it is wrong. Whether it's a grandparents, God, Prime Minister, it's wrong means wrong. The child has done something wrong, it has to be unanimous. All 3 or 4 of you come together, this is wrong. We have to give that message to him. There is no negotiation over here. There is no discussion over here. We can give that message in a different way. We can be really harsh, or we can be polite, or we can ask grandparents to give that message. And I just told you, they are smart. They know. So it all depends upon your involvement. I'm telling you, you do this for the next 15-20 days. Play a game which he likes. First you start with the small game. Next day you said you choose your game. Let him bring the game and you start playing. Do a fun, do some mischief, do some wrong things. Let him correct you. And the next time you will see. They will be a part of this. We, as a doctor, all of us know we have spent less time with our kids over the time. But this will definitely work. We are all, like, whatever I'm talking now, I'm not talking as a doctor, probably as a father. So all mistakes we have done and we have learned, and I really want you to do the same thing. That don't do those mistakes and try to be, and at your home also, if he listens to a grandfather more than the grandmother, tell this message to the grandfather. You keep on telling when he's in a receptive mode, when he's playing with them, all those things. They understand all those things. It's not like that they will not understand.
You said that a child learns or has the ability to learn 6 languages
Yes.
at a time. So I wanted to understand, both me and my husband speak different languages. We have different mother tongue.
Absolutely yes. Absolutely yes. I am also same. I'm Maharashtrian Marathi. My wife is Haryanvi, so my child knows Haryanvi. Okay. So it's absolutely okay. There is a child comes to my OPD. She is a Telugu. Mother is a Maharashtrian. She speaks absolutely amazing Marathi, Telugu also, English also. So don't feel like that. You should communicate with them. And try to communicate before they go to the what you call pre-nursery, daycare and all those kind of a thing. The reason for that is then in the nursery, whenever they go back, sometimes they say it could be a language confusion, but don't worry about it. It will be for some time. Because they will say, oh, everybody speak English. You speak all 3 languages at home. Once you are with you, so you speak your language. Once the child. You should. Because it opens up a lot of barriers. So initially my son also had a problem in talking with my mother because she knows Marathi and little bit of Hindi. So then they opened up. Now it is reverse. Can you teach me Marathi? Can you teach me Haryanvi? It's absolutely reverse. And sometimes for some words he comes back to me, why didn't you teach me this? So all of in the family, if they are speaking Telugu, let him learn Telugu, but simultaneously you give him exposed to the Kannada. So he might ask, what happened? This language is different. So this is the Kannada language. Absolutely. It will improve the confidence of him. We can speak in both languages. So now what happens is, the learning is not about talking. Learning is about listening also. So what happens is, if she keep on listening, right? So what happens now, ma'am? We are not expecting, so again this is an expectation bias. So we are expecting she should start speaking in Kannada, which will take some time. You keep on doing that. And whenever she comes back to you, I would like to see Kannada. And what happens is there are a lot of other things also. If you keep on embarking them, okay, English is the language of communication, English is the language, definitely you actually make the English stronger, but make it sure that whenever there is a chance, speak in Kannada. Means you don't leave it that until she learns Kannada. That doesn't mean that you're pressurizing her to learn Kannada. No, not at all, not at all. And all of us knows about this research that whose parents works, but nowadays we give them a lot of privileges, but initially the working parents will have a smarter child. The reason for that is there are a lot of things they do it by themselves. You will not realize. One day they will just come and they will surprise you. Good. Thank you very much. Thanks.
All right, one last question. One last question. Yes, madam. I think with this, yeah. Okay, I'm coming with the mic. I'm coming with the mic.
It's okay. Huh? Children.
Like if I say no at that moment, they stay calm, they leave to their place. At that momentarily we feel that it's easy, we are doing right parenting, they were calm and all. But we might not go through what's going on in their mind or how is it affecting. At that moment at social place or our workplace, we feel very comfortable, they are very calm and they are doing very mature. But at a going process, how is that?
So okay, so you're feeling that you said no, and what is going through the kid's mind? Anything, any change, any, and they will get the things now. So you feel that you have not given that chance to that child at that point of time.
My daughter, I have a 5-year daughter. Yeah, she's doing so spoken. If I say no, if she only looks at the situation, she avoids. Coming to me, or she avoids the whole thing, and she'll get into her own zone, reading her books, art and all. Few other friends of her, peer friends, get a chocolate or any attention. So, but what's going on at their level of mind or what's traveling in their thing? How to deal with?
So actually I would say you don't have to deal, you have a very good child.
Yeah, that's what I say. I feel the same at that moment that I'm dealing it very happily and she's also a happy child. But is it something?
No, actually not the highest level of intellect. You know what is the highest level of intellect? The highest level of intellect when you start taking care of others. Actually she's taking care of you. by not embarrassing you at that point of time. So let me tell you, their world is different. Okay, so if you ask me, like I'll share an example with my child. He did something wrong and then I scolded him and he was really uncomfortable and all those things. Then after some time everything went fine, absolutely okay. Absolutely okay, everything went fine. And then he was okay and then I came back to you should not do like that, this is absolutely wrong. He said, what you're talking, Papa, that is done 10 minutes back, let's move on. So what I want to, their world is completely different. That's absolutely okay. Who said they should not remember? They might remember, but at that point of time, if you have given a it is something, she wants to drink from this kind of a bottle, it's no. So whether she remember it is in a different way or in a positive way, it all depends upon them. So once she had a similar experience when you are not there, then she will realize, oh, my mother said correct thing. And let me tell you, don't feel bad about it, what she is feeling, if you have given a correct choice at that point of time. So they will not remember in a different way. Yeah.
So what should be parents' role, in kids' introversion or extroversion? How it is directly dependent?
So actually I would say give them an opportunity. If you feel your child is very introvert, not speaking in front of anyone, don't like if somebody comes, oh, you speak with them, go with them. Let them familiar with that. Let them familiar with the situation. And second thing is give them an opportunity. It could be a daycare, it could be a classes, and second thing is it all depends upon how do you actually interact with the other people also. Okay, and two kids could be completely different. So I have one kid who doesn't like to go outside and eat. He said, whenever I say him, let's go outside, no, Papa, home food. There is another one, he will kill anyone for having outside food. So there could be two different things. So you have like I told you, it's their personality. Why I should change their personality?
So do we have any role in deciding that personal direction?
No, I don't feel so. The only thing is you have a role in giving opportunities. If you really feel they're within themselves, they're completely into their own fortress, then probably you give them an opportunity, go outside with them more frequently, share expectations, not share experiences of you, I was like that, and then I started playing the cricket, or put it into any sport where they need a team effort because they will interact with a lot of other people.
Thank you so much, friends. Please put your hands together for the lovely session. Thank you so much, sir. Thank you so much for your time and wonderful insight. And without taking any more time, I would take the privilege of calling upon one of the special speakers for the day. We have is Dr. Aparna C. Madam is a clinical director for neonatology and senior consultant neonatology and pediatrics. Dr. Aparna C. is working as a clinical director neonatology and senior consultant neonatology and pediatrics at KIMS Cuddles. Ladies and gentlemen, please put your hands together as Madam comes on the stage, and we also have a small honorarium from our side. Thank you, Madam. Thank you so much. Thank you. Come on, put your hands together, ladies and gentlemen. Over to Madam this afternoon, and Madam is here along with her team, and she will introduce her team as well. Thank you. Chip.
So,
yeah, it's okay.
am I audible?
Yeah, you're audible, yes.
So I think we are standing between you all and lunch. How many of you are really hungry? Can we have something served in the hall for them?
Sure, Madam. We'll
so I have the pleasure of introducing my very dynamic team today. Can we have the presentation on? So let me please introduce Dr. Aravinda Lochani and Dr. Pranitha. Kindly put your hands together to welcome our team. We are going to kind of be there when on your very special moment. We are newborn specialists, so we are pediatricians who have specialized in neonatology. I'm Dr. Aparna, this is Dr. Aravinda Lochani, and she is Dr. Pranitha Reddy. So we hope to be meeting you all when you are ready to welcome your baby on your very special day. And we are going to actually take you through some questions which we thought would be interactive. And we have also prizes for those of you who are going to answer first. So how do we do this? Shall we have kind of raising up of hands to indicate whomever is ready? So this whole journey, this beautiful journey of 9 months of pregnancy, the crown of this journey would be, of course, the arrival or the welcoming of your little one. So how many of you are first-time parents? If you could please raise your hands. Thank you. So majority of you. So can the second-time parents please raise your hands? Okay, that's around maybe 15%. So you are at a little bit of an advantage. So I think we'll have top priority Rohini for the first-time parents. So if there is a tiebreaker, we will kind of use this as a criteria to kind of decide the winner. So shall we begin? Right. So we'll begin with the questions. So the first question is, according to the World Health Organization, exclusive breastfeeding is recommended for how many months? So I saw, okay, please, we'll bring the mic. So the first hand went up from Swati. So Swati, there is no prejudice, conflicts of interest. Her first child is my patient.
Yeah, 6 months.
Very good, Swati. So I think yours was the second hand. Right?
6 months, ma'am.
Okay. Dr. Madhuri is a pediatrician. So there is again conflict of interest there. So this is a very, very important message. And there are some more questions coming up along with this question. So now why do we recommend this for 6 months? Why not just 2 months? Why not just 3 months? Why is this so important?
Baby immunity.
Excellent. So it has been seen that exclusive breastfeeding for 6 months and early initiation of breastfeeding. So these are the two important yardsticks, variables when it comes to the success of breastfeeding. Exclusive breastfeeding means giving only breast milk and not giving any other food or liquid to the baby, not even water. The only exception can be, anybody, what can be given along with breastfeeding and it still remains exclusive breastfeeding?
Formula milk.
No. Definitely not formula milk. Then it becomes mixed feeding. You know, if you give both breastfeeding and formula milk, we don't use the term exclusive breastfeeding. So what else can be given? Very good, excellent. Only vitamins, minerals recommended by the doctor. That's the only other thing you can give to the baby in addition to breastfeeding. Not even water. No honey, no water, no gripe water, no cow's milk, no goat milk, nothing other than breastfeeding is what we mean by exclusive breastfeeding. And this is recommended for 6 months. The second yardstick I told you was early initiation of breastfeeding. Anyone knows how early should the first breastfeed given? 5 minutes. Okay. Now 5 minutes is great, but the WHO and other bodies generally recommend it should be given within 1 hour. 1 hour is what we mean is the time limit for calling this as early initiation of breastfeeding. These two are very, very important sort of, health indicators for the whole country. And how many percentage mothers do you think in India are actually managing to give exclusive breastfeeding for 6 months? Any guess? I wish it was 90%. So it is 42% as per the NFHS 5 survey. So it's not a very great proportion. So I believe, I hope that, all of you, parents to be, would be able to kind of be inspired to change this percentage and take it for the better. So I'm going to now ask each of you to give one unique advantage of this exclusive breastfeeding for 6 months. One of them, she has already said, we'll give her a prize. Your name?
Manisha.
Great, Manisha. So it improves immunity is what she has said. So by this we mean babies who are exclusively breastfed have lesser chance of developing all kinds of infections. Pneumonia, ear infections, diarrhea. These three major infections which affect children below 1 year, lesser with exclusive breastfeeding. Any other advantage, any of you whom you know, please raise the hand. There. Rohini, there. We need, I think, one more volunteer. And then we will come to you.
The bonding between the mother and child, which is very
excellent. Excellent. So better bonding between the mum and the baby.
Easy digestion?
Great. Easy to digest. So when compared to formula feeding, breastfeeding is easier to digest, which means the proteins are easily bioavailable. They translate into higher levels of amino acids. The fat in breastfeeding, is again more easily digestible. The carbohydrate in breast milk, does anybody know the name of the carbohydrate? There are different things like maltose, sucrose. It's lactose. So lactose is supposed to be the best form of carbohydrate for the baby. So these are all, components that make breastfeeding very easily digestible. There was one hand up there, Rohini. Yeah, the lady in the grayish green sari. Yeah. A unique advantage which has not been already said.
Yeah. Yeah, actually, apart from the medical advantages, it increases bonding between the mother and the child. So that's the one advantage with the breastfeeding, I think.
Absolutely. So she was also raising the same advantage. It improves the bonding between the mother and the baby.
It helps in sharing antibodies with the baby.
Excellent. So antibodies. Now, if supposing the breastfeeding mom has a viral cold like flu, many times parents ask, can we still continue to breastfeed? Will the baby also become infected? Now, even if you don't directly handle and feed the baby, still the baby may get infected because you're going to share the same room and a lot of similar things. But if you are continuing to breastfeed, the antibodies to that infection also will be transmitted to the baby, and hence the baby is likely to develop a milder infection. This is what was recommended during COVID. A lot of mothers who delivered during the second, third pandemics of COVID, who were having active COVID or who were PCR positive, used to ask us, is it okay to breastfeed? Now, will my baby also get COVID? Now, yes, it's likely, but still, it is likely to be less severe because the baby will also get antibodies through breast milk. So, breast milk is an instant source of what we say passive immunity. So the mother's immunity directly can get transmitted to the baby, whether or not the baby gets exposed to that infection. Someone raised your hand this second.
Hi ma'am. Once, not only the baby child, even mother also get the antibodies from the baby saliva while feeding. I have read it somewhere, but it's really a good thing to experience from the baby. It's something beautiful. Excellent. I can say.
So this is again a very interesting thing she has raised. Not just the mother's antibodies going to the baby. It is said that babies can also program the kind of breast milk that the mothers would secrete. So every mother's breast milk is very unique for his or her own baby. I mean, obviously for her own baby, be it him or her. Okay, someone raised your hand.
Ma'am.
So we need one more. Yes, you followed by
baby will have the more immunity power not only at the baby time but also in the later stages. We observe a lot of difference between the mom feeding baby and not feeding baby, and as well as it helps mother also to reduce her postnatal postnatal care also will be there for mother also.
Excellent. So she spoke about one maternal benefit. So mothers postpartum, the regaining pre-pregnancy weight and shape is more possible with breastfeeding. And you spoke about some, childhood advantages. So it has been shown that problems related to what we call as type 2, antibody response in the body, like asthma, autoimmune conditions, allergic disorders, these atopic dermatitis, skin allergies, these are all lesser in breastfed children. So allergic problems are also lesser when the child is breastfed. Sorry.
There are less chances of breast cancer for the mother.
Excellent. So breast and ovarian, isn't it? So two malignancies that are found to be lesser in mothers who breastfeed are ovarian cancer and breast cancer. So it's something which is going to confer a lot of short-term advantages and long-term advantages to both the mom and the baby. Yes, sir.
Yeah, I would like to say humans are like privileged species, and I think we are just following the law of nature, that any human being or any living being is actually first approaching a mother for the first feed. And second, you said unique advantages, so I'm thinking it just came out of my mind. It's not mother who is giving the milk, it's a baby who is taking it. It's the first law of survival. I think the baby is trying to survive by taking the feed, not mother is giving.
Absolutely. So you all know that mammals produce milk, isn't it? And most other mammalian species, they don't go to the store and buy formula, right? Not most, none of the other species have this advantage. So we, of course, we have the privilege of being able to choose alternatives, but also, if you go by the law of nature, this is what has been created for the baby, and every mother's milk, as I told you, has unique advantages for her baby. It is kind of programmed in such a way. So studies have seen that right from the fetal life, the baby's microbiome, the kind of bacteria in the baby's intestine and the baby's system actually modulate the kind of proteins and carbohydrates and macro and micronutrients in the mother's milk, and so hence that is the best possible milk for that baby. So all this is because we are going to be talking to you all about how to position, latch and attach your babies after your babies come out, and your knowledge and your awareness about all these advantages, you all are already so well read and well aware, is only going to make this process more easy and more enterprising. So I'll quickly show you. I think you have covered all of these advantages. And then, of course, the feasibility, if you have to travel somewhere, if you are breastfeeding, you don't really have to carry spoons, bottles, formula tin, and then cleaning solution, soap, bottle sterilizer. So this will become one whole bag,
What is the case of twins?
What in the case of twins? All these advantages are still the same. So what is your question exactly? Absolutely. Absolutely. Do not have to. So you are going to be proud father of twins? Okay, excellent. So congratulations. So not to worry at all. We have had a lot of our mums who have given birth to twins, multiples, who have also been able to exclusively breastfeed. Now, breastfeeding usually after the first 24-48 hours works on a local paracrine hormone basis is what we say. Paracrine basis means the more a baby sucks, more will be the local production of hormones and factors, and more will be the production of milk. So if a mother has twins and she is feeding both the babies, now both the babies obviously cumulatively will be sucking at the breast for a longer duration of time with a greater efficacy or frequency. Hence they will be automatically programmed to produce more breast milk. So this is also true for a single baby, it's also true for twins. So it's such a beautifully created mechanism by nature that one does not have to induce this artificially by medications or by artificial strategies. The baby can automatically regulate the volume, the quality and the frequency of milk production per se, and this beautifully sets in after the first 48 hours by means of the touch, the stimuli, the suck, etc., etc. And so it's all modulated by nature, by the local hormone production within the breast tissue itself. So all these advantages, and of course it's environment friendly. We don't have to use plastics for storing and for dispensing milk, for carrying it here and there. You can travel somewhere, you just have to carry your baby and maybe a couple of clean blankets, and you can travel anywhere.
For working moms, is it possible, like after the 6 months of duration, or probably the 5th or 6th month, is it possible to pump the breast milk and feed them throughout the day? Is it good enough for the whole day?
So it's absolutely recommended. So when you pump milk, usually, after your 6 months when you have to go back to work, you can pump and store milk in the refrigerator for up to 24 to 48 hours. In the door, between 4 to 8 degrees. If you're going to freeze it, you can even store it for longer, for up to 6 months in the freezer, in the deep freezer at minus 20 degrees. So up to 6 months. Up to 6 months actually we can commercially, we can store it. We even use donor human milk in our NICUs. So we do kind of freeze it for as long as 6 months. There's no change in the sterility or the quality of milk. It has to be thawed back to room temperature. Do not use the flame or a hotware oven for thawing. Preferably use a hot water bath. Okay, a bottle sterilizer itself can be used for thawing, or you have these thawing separate devices also. Thawing is a process of heating the milk back. So working mothers, once you are resuming work, preferably try to extend your leave, maternity leave, until at least 6 months completion. Once you're planning to go back, start pumping milk. So what you would do typically is you would feed the baby once before you leave for work, and also pump milk, leave it in the fridge. So your family can actually help by providing this express breast milk to the baby while you're away. While you're at work, have a single-use pump in your workplace. So maybe once in 3 to 4 hours, try to keep pumping while you're at work. And that pumped milk also you can bring back while you come back home. And as soon as you come back home, you directly breastfeed the baby and continue to breastfeed during the night time. So this would be something that most mothers would be able to manage once they resume work, and we've discussed all these advantages. So we have all discussed the advantages to the baby, the advantages to the mother, and the advantages to the community. Of course, it is cost effective. That I do not even have to say. The cost of buying, I think, formula, if a child is on full formula feeding, I think one formula tin gets used up in 4-5 days. Second time mothers, yes, you would agree? Okay, that would be the case, and then you end up spending close to 6-7 formula tins would be consumed every month. So that is obviously an added cost. So I'll hand over to Aravinda.
Excuse me, ma'am. Ma'am,
Yes.
one question. Like, what's the specific container, better container to store this breast milk at home in the freezer?
Yeah, so glass containers and stainless steel containers are very safe. But in terms of plastics, you now have plastic containers which are useful and can be safely used also for the storage. BPC free plastic containers, bottles are available for storage. So most of the brands like Medalla, and they all sell these BPA free plastic bottles. But if you ask which is even better, glass is absolutely safe, and stainless steel containers can also be used.
Thank you.
So you have all seen the benefits and the advantages of breast milk. So one thing I would like to add upon is start early. Soon after you have delivered the baby, like as ma'am discussed, try to feed early within 1 hour of life, and give frequent breastfeeds every 2 hours, so that your milk production will start and it will catch up with you. Okay. So now after you have given successful breastfeeding for the first 6 months of life, then you all know that we start complementary weaning foods. So let's go to the second question. So when do you start giving complementary foods? After 6 months. Actually, the WHO recommends it is after 6 completed months. So many of you might be giving like at the start of 6 months itself. So it's better to wait until 6 months completed for the baby. Why we should wait until 6 months?
Because digestion.
Earlier introduction of solids will lead to what?
Indigestion.
Yeah, indigestion, risk of diarrhea. So can we give cow's milk after 6 months?
No, 1 year.
1 year. Why?
Digestion. It's
Just
hard
say
to digest.
Yeah,
Sit
it's
and
hard to
answer.
digest.
It's even harder for us also to digest.
Yeah. So
Maybe diluted if possible.
yeah, diluted cow's milk also don't give between 6 to 12 months of age. If you want to give cow's milk directly after 1 year of age, you should give. So along with the weaning foods, breast milk feeding should be continued between 6 to 12 months of age. So how frequently do you start giving? After 6 months, like what do you prefer initially?
Mike.
Can anyone tell?
2 times.
Yeah, first initially once or twice. So what would, like how you start? Second time mothers don't answer. Only the first time mothers should tell. Yeah. Home-based
Crushed,
food,
semi-solid.
like
Yeah.
rice and dal, you can fry them and then make it into powder, and then
Yeah.
make it into a porridge type.
Yeah,
Like
porridge and banana, like mashing banana.
Uggu.
Uggu.
Yeah, like that they
Yeah.
say.
He's ready for the twins. So
It's
at
better
6
to
months
have a
we'll come and
liquid
check if you are making uggu for your babies. Twin, okay. So here the common question that a lot of parents ask, doctor, can we start Cerelac at least before 6 months? So Cerelac is also cereal. It's also solid. It is also same as uggu. So any kind of cereal, any kind of solid food should be started after 6 months, because the earlier you start, the child loses interest in breastfeeding. So ultimately it will lead to effectively a decrease in the breastfeeding, and hence we want to keep breastfeeding undiluted, unaffected until 6 complete months. We only introduce solids at 6 months. Unless there are really pressing, reasons where the baby is not able to gain weight properly, and sometimes the mother is trying hard, sometimes babies are not ready to accept formula feed. Some bodies recommend between 4 to 6 completed months, like European bodies, they recommend that you may think of. But unless and until there is a pressing medical reason, we should try to always start solids. And biscuits are not considered again as deviations from this rule. A lot of parents ask us, the baby is looking very eagerly at biscuits and very eagerly looking at us when we eat. Can we start giving something?
It's a challenging task to convince our parents not to feed.
Not to feed, yeah. So remember, they may look very eagerly at 3 months, 4 months. Once you start giving solids, they will ultimately, you will have the same struggles for running behind them and feeding. Ultimately when we start. So all second time mothers are vigorously nodding their head. So don't give in into that feeling of temptation of having to feed the child earlier than 6 months. 6 months is the cutoff for all the best of reasons, so that we don't interfere with all the benefits of breastfeeding. And again, as Dr. Aravinda said, try to give a mix of cereal and pulse, 3:2 ratio. So typically, we kind of grind the cereal and pulse initially for the first maybe a month or two to make it into a easy ground, consistency, powder form. You can initially toast or heat the cereal and dal in a tawa. So you seem to have a lot of interest in this process, and then powder it in mixie, and then you boil it with water. Make it into a thick paste. The consistency should be that you lift it with a spoon. It shouldn't be too liquid and that it drips down, or it shouldn't be too solid. So that's the right consistency. A little bit of ghee is fine. Can you add salt and sugar? No. Very good. Excellent. Yeah, you can add flavor, dried fruits are fine, powdered dried fruits are fine, some jeera is okay. Try to add one new thing every 5 to 7 days. Don't add everything at the same time. So initially you will start with rice and maybe, moong dal or chana dal, then keep adding the complexity. Then you can introduce tur dal, urad dal, and one by one, to make it more and more the flavor different. And you can add something for garnering and flavor, but don't add salt and sugar typically between 6 to 12 months, because it's ultimately we know it's habit forming. So until 1 year, the World Health Organization recommends that the complementary food should not have salt and sugar. And of course, after a month or so, we make it more and more closer to the typical consistency we have. You can start putting it in a cooker and just mixing it with your finger and give it. After a month or 2 months, stop, putting it in the mixie and making it completely into the powder consistency. Because sometimes we also find parents coming back at 2 years and saying we are still putting it in mixie and feeding our child. No, then that is completely something that we have habituated the child to. The child can effectively start chewing and eating most of the solid food in the consistency that we eat by 9 months. Okay, by 9 months itself, the child's mouth is ready for chewing and eating food. You may just have to, mash it a little bit with your finger, but you don't have to put it in the mixie and make it like a cool kind of consistency. Okay, and the introduction of differences in texture, flavor, color, all this must be near complete by the time the child reaches 1 year. So 1 year is typical time when we say, when we say family pot diet. So family pot diet means the child can simply pick up anything the child wants to eat from our plate. The typical time for that is 1 year. So by 1 year, please remember your child should have kind of had a flavor of everything that we eat. And from 1 year, as Dr. Aravinda said, introduce cow's milk also. You can introduce animal milk. Until 1 year, don't introduce animal milk. And again, non-vegetarian food, pieces of fish or chicken, also by the time the child reaches 1 year, you can add. Egg can be started from 9 months itself, both the white and the yellow.
So generally they mix that, egg in the milk, and they used to feed us.
They used to feed you? Egg and milk. Okay.
So they used to mix the raw egg in the milk, and my nani used to give it to me. So can we do that, or we have to give a boiled egg?
There's nothing like you have to give it in this form, whatever form children like. A lot of parents feel that boiled egg may not be liked by children, maybe because of the taste. So, a cooked egg, maybe you can, make it into small pieces, cook it with a little bit of flavor, and mix it with rice and give. Whichever way your child prefers is okay. You can give it in any form, but you can give the whole egg, is what we're trying to say. And egg is a very wholesome source of protein.
Usually, parents feel that after 6 months the child is looking a bit lean and all. So usually the weight doubles by around 5 months. First they look chubby in the first 6 months, and then the weight triples by around 1 year of age only. So it's okay. Like, you need not feel that my baby is not gaining weight and all that. Initially in the first 3 months weight gain will be maximum. Then slowly it slows down, and the baby reaches 3 times of the birth weight only by 1 year of age. Okay. So we'll move on to the next question then. Dr. Pranitha will take this question.
So hi, our next question is, when can you bath your baby?
7 days after, 7 or 5 days after the
Rohini.
She told correctly.
Excuse me.
She will.
After the umbilical cord sheds off.
So she's right. We'll usually bath the baby after the umbilical cord falls off. So why do we wait till the umbilical cord falls? So why do you want it to be dry? Yes, very good. So keeping the umbilical cord moist leads to infections known as omphalitis. So we usually try to keep it dry. And should we apply any oil to the umbilical cord? Strictly no. Any powder?
Yeah, they are giving. They are given to them.
Do we need to apply any powder to the umbilical cord? No.
She got the right.
So unless there is any infection, usually it is not required to apply any powder to the umbilical cord. So how long do you want your child to be bathed? For 5 minutes, 10 minutes, half an hour? Hardly 2 to 3 minutes. Okay. So for the first couple of days till the umbilical cord falls off, we'll usually do a sponge bath just with plain water. So after the cord falls, we can give for a maximum duration of maybe 5 minutes, okay, but not to prolong more than 10 minutes because it will lead to hypothermia, that is fall in temperature. So temperature maintenance is again another important thing, because if you maintain baby's temperature, baby's weight gain will be better and there will be a lot of lesser risk, less risk. So what do you want to bath your child with? What? Lukewarm water. And
In terms of solution or cleansing agent? And our soap versus baby soap versus...
So strictly baby soaps need to be used because the pH of baby soap suits the baby skin. So any brand is okay, but maybe Sebamed or Aveeno or Johnson's will be okay. So do you want to do oil massage for your babies before bath? So what oil do you want to use for the massage? Almond oil, okay. Okay, so we would prefer to use either coconut oil or olive oil or sesame oil rather than much.
Yeah, we also heard it today for the first time. No comments on that, I don't know.
No.
Castor oil is low because it's a little viscous, so it tends to block the pores. Any other oil is fine.
So don't use very aromatic oils or very thick oils like almond oil, castor oil and mustard oil. You can use the rest of the things.
Typically around the time that you start giving bath, and that, as you answered, is after the cord falls down. So from that point of time, you can actually start applying oil. Earlier also you can apply oil, but it's just that it may remain on the skin and the child may feel baby may feel a little uncomfortable. once you start oiling around the time of bath, it will actually get removed during the bath, and following bath you can use a moisturizing lotion, etc. Definitely avoid powder is another thing. You know, a lot of grandparents especially are very fond of powder because they want the baby to look very fair from the first day. See, the skin tone of the baby will keep changing, and some babies may look very dark, some babies may look very pink and fair on day one. Don't get deceived by that. The color keeps changing and may change maybe 3-4 times in the first 1 year. So,
yeah, that's a strict no actually. So you can apply kajal either on the forehead or on the side, some people put, but don't apply inside in the eyes. Okay, don't put any drops in the eyes or ears. That traditionally some mothers say na applying breast milk also inside the eyes, ears, and also many traditional practices will be there, but don't apply anything in the eyes of the baby. It may lead to eye infections also. I think this is easy, I think. Maybe you can say why we need to give vitamin D, because this is easy. And one more thing is mother's milk is kind of less deficient in vitamin D and vitamin K. So vitamin K is usually given by your doctors for the baby at the time of birth.
So again, multivitamins are not really needed for a good weight baby. Okay, so A to Z drops and all these multivitamin drops you can skip for the normal weight baby. Now we sometimes use for babies who are low birth weight. That is a special situation where we will recommend ourselves. Again, calcium and calcium phosphorus syrups are also not needed for babies who are more than who are born more than 2.5 kgs. Iron drops we generally recommend after a certain period of time. So for a good weight baby, iron is generally started if the baby is exclusively on mother's milk after 4 months. So between 4 to 7 months we add iron drops, because again breast milk intake of iron, content of iron is somewhat lesser, but it is very readily available form of iron. Vitamin D and iron are the two important vitamins and minerals which are somewhat insufficient in breast milk. Otherwise, breast milk is such a complete food that it takes care of all other multivitamin intakes. That's why multivitamin drops are also not routinely recommended. So what are all the uses of vitamin D? Anybody? Excellent. So it's needed for bone strength, immunity, prevention of infections, teething, resistance to infections, excellent absorption of calcium, like lot of other benefits have been found, and even prevention of asthma and allergic diseases. Almost everything, you can say, starting from heart attacks, strokes, asthma, they have shown in studies that vitamin D can prevent. So such a very, very important supplement. I'm sure all pregnant mothers, all of you are also on vitamin D supplements.
Okay, let's go on to the next question. How should you position your baby for sleep? Yeah, it's good to wrap the baby, but what position you prefer? Side? No, anyone else from back? No, you have answered already. We'll give chance to the people who are in the back. So anyone from backside rows, anyone want to answer? How will you position your baby during sleep? Yeah, it's correct. Yeah, baby's face should be facing up towards the ceiling. Why? Because breathing should not be interrupted. Baby should be straight, and the mattress which you choose should be firm. And don't keep the baby on a soft cushion, or don't keep soft pillows near the baby. And if you are keeping the baby face down, means you should be near the baby, like tummy time we say na. So at that time you should always be near the baby. So this position helps in preventing like some conditions are there, like sudden infant death syndrome and all. So this position is helpful in preventing such conditions.
Until the baby rolls over on his or her own, try to not keep the baby in that position. So normally babies will roll over by around keeping the baby on the tummy, because the chances of the baby's nose getting accidentally suffocated are slightly more. Now, you might have seen some children prefer to always turn to one side, some babies, and their head also will get flattened on that side, isn't it? So that happens very often because their bones are very soft and malleable. So some babies, their parents will say, whatever we do, he is always turning to this side. And this side head is flat, this side like this. Now, even if that happens, don't worry, it's not something which is permanent. It will get molded automatically when the baby again starts sitting and rolling over. And when that pressure stops, that molding will stop. But still, it is not just for the flattening, but it is because of the stimulation that they get from all the sides and to all parts of the brain, that it is recommended that the baby's head should be in midline as far as possible. You know, for babies where you're finding it little difficult to position them, you have these circular pillows and all that available, and now you can place cushions on both sides so that you keep them in midline for most of the day.
Ma'am, we have those traditional jhulas, like which are not stiff. So is it recommended that we put the baby there? Like we used to sleep in the traditional jhulas, and our parents tell us that children have a better sleep in that. So is it recommended?
From the positioning angle, there is not much of a contraindication or a recommendation against jhulas. But from the sleep hygiene perspective, if you get the baby used to a certain way of putting the baby to sleep, the baby also gets addicted to it. So sometimes we pat the baby on our shoulder, sometimes we rock the baby, sometimes we put the baby on jhula. Now once you start doing something, be ready to keep doing it again and again. So babies who are used to sleep in the jhula may want jhula until they grow much bigger, and then it becomes very difficult to even rock the jhula. Best is that the baby goes to sleep on the physiological position, like as madam said, with the head facing upwards on a reasonably firm mattress. It shouldn't be too soft. A reasonably firm mattress that you can gently pat, or you can just quieten the room, just dim down the lights, eliminate all the sound, maybe gentle music, or you can sing some song. That would be the closest to what is the normal pattern of going to sleep. But if your baby wants to be lifted and rocked a bit, then be ready to keep doing it again and again. So create a little bit of a sleep hygiene, same place, same bed, same time, same lighting, same sound, etc., so that the baby knows psychologically that this is sleep time. So while holding the baby, okay. So there is no one recommended position. After feeding, we generally recommend that the baby should be placed, erect, upright for at least 15 to 20 minutes. Again, while doing this, try to avoid excessive pressure on the baby's tummy. Very firm pressure on the tummy may sometimes make the baby very gassy, and the baby may reflux out milk also. So try to keep the baby erect, avoiding very undue pressure on the baby's tummy. Other than that, you only need to ensure that the baby's neck is not excessively folded forwards or folded backwards. So that's the only thing. You need to position or support the baby's head in such a way that the head is in the neutral position, the neck is in the neutral position. That's the only safety.
So, do babies gain weight right from day 1, day 2, or do they lose some weight in the first few days?
They lose weight.
So, how much weight do they lose?
200 grams.
200 grams.
Yeah, 7 to 10%. Whatever the weight is, like 200 to 300 grams.
Great. So usually if your baby is 3 kgs, for suppose, baby might lose up to 10% of weight loss in the first 1 week of life. That is, baby may lose up to 300 grams. So usually it is physiological or normal to lose 20 to 30 grams of weight each day. So why does this weight loss happen? Because of the water content.
Yeah, water content in the body.
Yeah. So right.
Because they are in a fluid till that time. They are mostly in a fluid, so their body tends to absorb the fluid, and once they are born, they it's a process that we tend to
So
lose
they
out
have a
that
lot of water in the extracellular spaces. They lose that in the first few days, and then slowly they start gaining muscle. So it is normal to lose 20 to 30 grams each day, and it is normal to lose up to 300 grams in the first week. But by the end of 10 days, baby should be regaining birth weight. Okay.
Injectable.
Okay, great. Injectable vaccines to any oral vaccine to be given? Let's try it. He's standing next. Polio drops, excellent. One gives to. So I'll ask you one more question. So is this oral polio drops, is it live viral drops or killed viral drops?
I have no idea, but it's oral drops.
Live attenuated, excellent. So the oral polio drops, so one gift here. They are live polio drops. So total of 3 vaccines.
I think our audience are all well read. They are saying live attenuated everything.
Live attenuated means they are live viral particles, but their virulence is reduced. So like we had COVID vaccines recently, both the COVID vaccines that were available in India, they were not live ones, isn't it? One was a viral vector vaccine, both were killed COVID vaccines. But polio, we have the oral one which is live viral, the other one is killed. So we have 3 vaccines. BCG is for preventing tuberculosis. Of course, tuberculosis has become almost unheard of, but still we should give BCG because, you know, giving BCG reduces the severity of tuberculosis. If at all later the child gets exposed to TB, by around 80% to as much as even 100%, the severity of the severe forms of tuberculosis can be prevented by this BCG vaccination. And you may be surprised to know that India is one of the very few countries where BCG vaccination is still practiced because tuberculosis still is endemic in some parts of India. The other one is hepatitis B vaccination, which is for preventing viral hepatitis, and of course oral polio drops. And when is the next vaccination usually? 6, 10 and 14 weeks, and of course you have there are around 6 diseases for which the 6 or maybe 8 diseases actually for which preventive vaccines will be given at these 3 time points. So yeah, we are there for that one. We'll be telling you in detail. Now, one of the things I wanted to tell you is after you give the BCG vaccine, you may notice something, which is a small bleb, which starts after 3 weeks, 4 weeks, and it will become a little larger until 3 months, until it bursts. Sometimes water or pus-like material will come. That's absolutely normal. We don't have to worry about it. You don't have to put an antiseptic over it. That's normal. And all that happened, and before we all got our small scar. You would have seen on your left arm, we have a small scar. So that scar evolved and was formed in a similar fashion. So that just indicates the vaccine. Now, in case it doesn't happen, some parents worry. Our baby didn't have that blood. What do we do? Should we repeat it? Now, older school of thought, they used to think, okay, you must repeat it. But now nobody repeats it. As long as the vaccine was given, some children may have the reaction, some children also don't have. So you don't necessarily have to repeat the BCG vaccination even if that blood didn't come.
Yeah, vaccination. So is it something that we should do?
So you just report to the nurses or the doctors there, 1 dose of paracetamol would be sufficient. If temperature crosses a certain limit, usually beyond 99.5 degree Fahrenheit, we would give 1 dose of paracetamol. It's very common to have fever. Not having fever also is not unusual. It's fine.
So let's go on to the next question. What should be the temperature of a normal baby? 98.6. Yes, correct. 98.6, or in centigrade also you can say more than 36.5 to 37.5 degrees centigrade. That's why as soon as the baby is born, we take utmost precautions to maintain the temperature of the baby. We usually start skin to skin contact also within the first 10 minutes. Once the baby is born, we'll do a brief examination of the baby to check for any anomalies, give the vitamin K, and then start the skin to skin contact. So this helps in preventing loss of heat from the body, which is called as hypothermia. Okay, so hypothermia leads to lots of problems in the baby, like loss of weight and poor feeding, all those things. So after the skin to skin contact, we ensure early breastfeeding and keep the baby wrapped and warm. So ideally the room temperature also should be maintained between 26 to 28. So if mothers are feeling hot and sweaty and if you want to switch on the AC also, keep it on for some time and then make sure that the room is not very cold. Okay.
So if you don't have the AC, how do you know the temperature is right for the baby, the room temperature? If you have a AC, as ma'am said, keep it 26 to 28. If you don't have an AC and obviously we don't have a room thermometer, how do we know that the temperature is?
Hands should be warm, not cold.
So the baby's abdomen, the baby's tummy and the baby's hands and feet should be similarly warm. Should be the same, should feel the same. And instead, if the baby's abdomen is warm and the hands and feet are cold, it means baby is cold. So Rohini, one prize to sir. And also remember that the temperature at which, we feel just a little warm when we wear a full hand shirt is right for the baby, is the perfect temperature for the baby. Now if you are wearing a full hand shirt or a full hand dress and you feel just a little warm, that's right for the baby. You also don't have to suffer in suffocation and heat. A lot of mothers come sweating and they're saying, oh, it's so hot, we are very worried. No, you can use fan, you can use AC, keeping at 26 to 28. You can use a little bit of cooler in summer. It's perfectly fine as long as the baby's hands and feet are remaining warm. And you just feel a little warm in full hand, but in half sleeve, if you're comfortable, that's right for the baby.
And usually many of the parents wait until after birth to buy a dress to see whether it's a girl baby or a boy baby, and then they'll wait until the shop opens to get the dress. Till that time the baby will be naked with only a diaper and baby will become cold. So just keep a dress ready. As soon as the baby comes, dress the baby with cap, socks, mittens, shirt also, and keep the baby wrapped. Okay.
Those of you around your 30 weeks plus, have your delivery checklist of things written down and even packed in a bag, for any kind of contingency situation, which will have, you can go through online checklists. It will have one set of dress, maternity wear for yourself, for the baby, diaper, and a lot of other essentials which you may sometimes forget to pack while you're going to the hospital for your, delivery admission.
I think I have already covered this question.
Ma'am,
How
I
long
had
does
a
it take
question
for the
about the
umbilical cord to
umbilical
fall
cord.
off? And what should you apply for the cord to fall? Do you need to apply anything? Yeah. So the more drier it is, the faster it will fall. See that the diaper doesn't get stuck with the cord. Keep a little away from the cord. See that it remains dry so that it falls easily. So it usually takes 7 to 10 days for the cord to fall off. So which of the two indicate good attachment? Name at least 2 signs based on this. Like while latching the baby, what are the 2 signs you notice in the baby and with the attachment which you, think of the picture.
You can compare both and then tell. The first one, what the baby is doing?
It's sucking.
No, both the babies are sucking, but what is the difference?
It's biting.
Baby is more closer and
Second one I feel, ma'am, because the nose is not blocked.
here also the nose is not blocked, no?
In the first one it's going very close to the.
I think we should ask Madhuri.
First one, because the complete areola should be sucked by the baby.
So the entire nipple and areola should be inside the baby's mouth. Baby's mouth should be very wide open. The upper lip should be slightly curled in. The lower lip should be outward. And baby needs to be supported on one hand as close to your body as possible. Baby's tummy should be touching your tummy. And nose shouldn't be blocked. These are the signs of good attachment.
So very often mothers worry about the nose getting blocked. So babies are very smart individuals. They don't allow their nose and all to get blocked when they are feeding. They know the perfect technique. So the key here is to bring the baby as close as possible. The baby shouldn't be facing the ceiling. The baby should be facing the mother. The baby's abdomen should be closely in contact with the mother's abdomen, mouth wide open. And very, very important, the baby shouldn't be doing just sucking at the nipple, and the entire areola should be in the baby's mouth. Really, really proud of all the husbands who know the correct answers. So I'm sure you will be great companions for the successful breastfeeding of your wives. So as the saying goes, we are becoming, we are delivering or we are pregnant. So we are breastfeeding again. It's a very emotional experience, and mothers need a lot of support during this phase. A lot of moms who face flat nipple, sore nipple, bleeding, cracked nipples, etc., etc. Early identification of improper attachment is the single most important step for preventing most of the nipple problems and painful breastfeeding later. So right from the first feed, try to be very conscious of good latch. That would make the baby also, be able to successfully breastfeed. I think we are done with all the questions, and we. Yes. Now it's up for you to ask.
Ma'am, can you please suggest any breastfeeding pillows we browse through? So there is something called the spine should be straight in that direction. There are which is more foam, like memory foam, the other one which actually gives support for the back. Any suggestion? Because there are multiple options.
Breastfeeding pillows, the core thing is that the mother's back should be well supported. The mom shouldn't be bending to the baby should come to the mother. That's the key thing, because you should remember, you should continue breastfeeding for 6 months, and it should be a painless experience for the mothers. They shouldn't develop back pain, etc. Any brand is fine, but the key thing is the sitting position should be well relaxed and well supported back. You can have even foot rest. Any of the available brands of breastfeeding pillows can be used. You also have, these, C-shaped pillows for positioning the baby, which also can be used. It's not that they are necessary for achieving the proper positioning, but they do definitely help.
We already have a kid. The second one. So the question is, thank you. For some mothers, the milk production will stop by 4 to 5 months, right? And you suggested not to take animal milk for 1 year. So what is the alternate for milk then for baby?
Your question was milk production stops by 4 to 5 months. Okay. So usually once the mother starts feeding the baby, so it's a demand supply kind of thing. Why it stops early is because of infrequent feedings, not giving feed particularly in the night time. So if she wants to feed for a longer time, make sure you get up and feed the baby during the night times also. And by any chance, if the milk output becomes less, then and baby is not gaining weight and facing such issues, then we will suggest formula. So after doctor recommendation only, it's better you go for an appropriate formula. Stage 1 we usually suggest.
Formula is better or buffalo milk is better?
Yeah, that's what in the beginning also I told. No cow or buffalo milk in the first 1 year of life. Don't give diluted cow or buffalo milk also, because that leads to again improper weight gain, diarrhea, poor immunity, so many problems.
Excuse me.
Ma'am, just want to ask one problem. Actually, when our daughter, she's a 3 now, so when she was 1 year old, my wife, she was COVID positive. So after that, a doctor advised her not to breastfeed. So after 1 year itself, we had stopped it. And after maybe 1.5 years or 2 years, she suddenly started thinking of that, and she's asking, I don't know, maybe she had seen on TV or whatever, I don't know. But she says, I want to drink milk then. So now after our second baby, apart from that, can she also be? I mean, this was a question for me, so my wife always laugh on this, but just wanted to ask.
In general, first thing is, I'm very surprised why actually breastfeeding was stopped, because as I just discussed, COVID is not a contraindication unless her health does not permit her to feed. If she's really, exhausted, understandable. If you were really, not well enough to feed, that is a different situation. Now, coming back to how long to continue feeding, typically the guidelines recommend until 2 years, continuing breastfeeding until 2 years. Now, beyond 2 years, there are mothers who do continue. If you ask me in terms of benefits to the baby, it may not be as beneficial as in until 2 years. Because after 2 years, obviously the baby depends, the child needs the solids and the regular, family food more than the nutrients that is available from the breastfeeding alone. So in terms of benefits to the baby, yes, it may not. But if your child is, the reason the child would demand breastfeeding at this point of time is not for the nutritive value, but just for the sense of security and bonding with the mother. Now from that perspective, if your child really likes the experience and it is feasible for you, there is no harm in continuing breastfeeding beyond 2 years also. But it may not be sufficient for the baby's nutritive demands. Obviously, the child has to be fed all the other regular food that, as an adult that we would be taking. The child needs a lesser quantity of the same type of food and the same diversity of food. But continuing is also not going to be of any harm, but we cannot depend on it for the nutritive value.
For my first kid, I used for sleeping him, cradle for him, for good. Then it is also problematic to stop. Then I tried breastfeeding up to 2 years. Then that is also very horrible to stop after sleep him by feeding. Then what is the best way to follow to sleep?
To make the child sleep.
Yeah.
So again, this brings us back to that notion that when the child is used to a certain modality of feeding, lot of children breastfeed their way to sleep. So her question is, how do I stop breastfeeding because the child is used to breastfeed and then go to sleep, isn't it? So this is a frequent problem, especially when women are working mothers. They are already exhausted after the day long work, and then the children, the baby wants to cling on to the mother even after coming home. So the quality of night sleep is disturbed, etc. So as I told you, it is more of a psychological dependence, usually beyond 2 years. The child may not nutritively depend upon the adequacy of breastfeeding. So it's possible to actually wean by, for a few days, you may want to actually hand over the child to your husband rather than you being next to the baby. Because finding you next to the baby itself, the child will just want to come and be in touch with your, with your body, with your skin, just for the sake of the warmth and the sense of security. So you can actually allow another family member, your mother or your husband, to actually sleep with the baby. The use of hormonal medications to forcibly stop breastfeeding is generally not recommended. See, there are medications which can be used for that purpose, but generally they play with hormones and then we don't generally recommend them. So try to use more simple and physiological measures, maybe going to a different room and giving a break for 2 weeks. The child may automatically get away from that psychological feeling of dependence. That's the thing that, that works most often. And let me allow my colleagues to answer.
Yeah, you can increase the duration between 2 feeds slowly, like initially you will be giving every 3 hours, 4 hours, like that, no? Then slowly cut down to only night feeds, and then, like as ma'am said, sleep in a different room. Like it's hard to break a habit for a child. So slowly only you have to try, never force your child to do.
Yeah, it should never be done forcibly because it can induce some other, issues in the child, behavioral issues, etc. So it should never be harsh or forcible. Let it be more gentle and let it come more naturally. Sleeping in a different room and a little physical distance is something that generally works, rather than drugs like carbigolin, etc., etc. I think one final question I have for my colleagues. I'm going to ask you your recommendation on stem cell banking versus delayed cord clamping. So please tell us what is delayed cord clamping and what is your take? We'll take 2 more questions after that.
So once the child is born, usually we clamp the cord, umbilical cord. So umbilical cord is clamped and then baby is taken to the mother. So we usually, the American College of Obstetrics and Gynecology usually recommends to delay the cord clamping for 30 to 60 seconds so that baby gets more of mother's blood. So this usually helps baby in recovering from anemia. Usually most of the babies develop anemia at 4 months, later till 1 year of life. So that is usually avoided by delayed cord clamping. And anemia is a much prevalent problem in our country. So if iron stores are rich, Usually the cognitive development, mental development, overall performance of the child will also be much better. His appetite will be better, his growth will be better. So it is recommended for all the babies to get delayed cord clamping after birth, except if the baby is asphyxiated. That is, if baby is not crying at birth, then we have to immediately shift the baby to the warmer and do the necessary resuscitative measures. Otherwise, it is recommended to universally to do delayed cord clamping for everyone, all the babies.
So delayed cord clamping is something that is recommended now. Every baby, the cord clamping is delayed until 1 minute because, placenta stores around 500 ml of blood. At the time of birth, the baby's blood volume is around a 3 kg baby, the blood volume is around and so many other cognitive benefits iron has. And iron deficiency, it's as common as 60% of children. So it's one of the most prevalent conditions. Now, on the other hand, stem cell banking is harvesting the baby's, the stem cells for the subsequent treatment of genetic conditions. There are two areas of caution that we would like to share with you here. Now, one is, there are some genetic conditions that are there prevalent even in the stem cells. So if, for example, thalassemia or certain types of hemoglobin problems like sickle cell anemia, these are all genetic problems. These gene-related problems can be prevalent both in the umbilical stem cells as well as in the baby's inherent, red blood cells or the corresponding cells of question. So baby's own stem cells are actually not useful in the treatment of certain genetic conditions. They are only useful in some other genetic conditions which may not have their origin right from the umbilical stem cells. The other thing is, when we do stem cell banking, sometimes, when it is done very early, it may interfere with the process of delayed cord clamping, which is for preventing a much more common problem, which is anemia, and cognitive or intelligence deficits in the children, which is critically related to iron. So we as pediatricians are very, very, in favor of the intervention of delayed cord clamping. Definitely that is something that should not be compromised. Stem cell banking, a decision can be taken on an individual case-to-case basis, particularly if there is some family history of a genetic issue, it may be particularly relevant to that family. In other cases, it can be discussed on a case-to-case basis and a decision can be taken without compromising on delayed cord clamping. Okay? Yeah.
Ma'am, actually we thought of asking this to Shilpi ma'am as she is not available. So recently the human milk bank is opened in KIMS, right? Can you please tell something about that so that we can get some awareness and the process?
So we have recently inaugurated the Human Milk Bank, as you all might have seen. So the Human Milk Bank functions with the help of the donor mothers only, which is a freely voluntary program. Like after you have sufficiently breastfed your baby, so most of the mothers will have adequate amounts of milk. So even if you don't realize that, you will be having milk. So that milk, excess milk can be donated, which will obviously mothers will be screened for certain infectious conditions first. So once the milk is donated, that milk is pasteurized and then stored and then distributed to babies who don't have sufficient mother's milk, like some preterm babies or mothers having certain medical conditions where she is not able to directly breastfeed the baby. So you after feeding your baby, you can help other baby also who is in need of mother's milk, which helps in reducing the infections drastically. So whenever you come for OPDs, for vaccinations and all, you can donate one bottle of milk. Yeah, it will be a pooled human milk only. Pooled milk which is free of infections. Pasteurized milk.
All right, I think no. Thank you so much. Thank you so much. So I think we are done.
One last, request, since you raised about milk banking. So any of you, subsequently when you all become mothers, if you actually face this